Welcome, world. How y'all doing? Obviously I just started, so a bunch of people are starting to come in. So we're about to see what's going on. About to see what's going on. About to see what's going on. How y'all doing? Oh, we got one person that showed up in here. Yes, that's what I'm talking about. How y'all doing? How y'all doing? We just getting set up. We're just getting set up for letting people roll up in here. Shout out to everybody that's decided that they want to jump in right now. Hey, if you're new here, welcome. Hey, let me know who you are, where you're from, and we're about to get it on and popping. About to get it on and popping. I know that everybody comes here not to look at me, but they want to look at these questions. But we're gonna be continuing the question. You late? What you mean? You just got here, Tippy. You just got here. I just got here. Ain't even been on like over a minute. Just got here. We Gucci out here. We good. We good. Hey, so if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. I want you guys to smash that like button. Make sure you guys share. Hello, hello. Is it a Telemedo? Is that it? Telemedo? So shout out to you. Welcome. I don't think I've ever seen you before. So welcome to the live stream. We're going to be going over NCLEX questions. These are both good for RNs and LPN students that are trying to get their license when they get there. Shout out to the gang. Shout out to the gang. Appreciate the Rose Big Dog. Charlotte says hi. What's up, Charlotte? How are you? Is that Keisha? Keisha said, hey, everyone. Hey, girl. Hey, how you doing? Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. There you go. Third year nursing student. That's what I'm talking about. Rochelle. Rochelle is a... Rochelle, what can I say about you? Rochelle know everything, yo. I don't even know why I'm here. So she might as well just, be my replacement. She might as well just be, the coach or the instructor of these lives because she be answering everything. And then she don't be answering everything. Then she be leaving. You know what I'm saying? Shout out to my man AJ. What's up? My man, 2 classes left. You almost there, big dog. You almost there. You know me. Shout out to the gang. You already know what I'm finna do when I do them psych lectures. You already know what's up. So shout out to all 16 of y'all that are up in here. If you're new here, my name is Kevin. I go by the Boot Nurse right there on all social media platforms. Make sure you guys check that out. YouTube, Instagram, X, Thread, all that good stuff. So we're just letting people kind of roll up in here before we get started with the questions. These questions are a continuation from Monday. I kind of cut it short on Monday because, your boy was tired. He had a whole bunch of stuff going on. So, there's that. Psych, says the man with the 7-day NCLEX course and mad experience. All right, cool. I'll let you have that. Keisha said I'm 4 weeks away from that exit PN. Hey, don't cry over that. Don't be crying over it. Don't be scared. If you're scared, go to church. Y'all already know what's up. Y'all know what I say. Hey, I was going to quit. Any advice? Don't quit. I'm in Minnesota, starting nursing school in the spring. Shout out to you. Who's that? That said that. Charlotte. Okay. Charlotte, welcome. Hey, welcome to all 100 plus of y'all that are up in here. Just letting me run my mouth. Hey, I know what y'all are ready for. I know y'all are ready for these NCLEX questions. I want people to come up in here. I want to know who you are, where you're from, all that good jazz. We're going over pharmacology questions, continuing from the pharmacology questions that was requested on Monday. But like I said, your boy was tired, so he got off. Because, that's just what we do. Make sure you guys smash that like button. Make sure you guys share. Because the more that you share and the more that this is exposed to people, the more that they can get it. You never know how these questions or even just this whole live could really impact somebody in a good way and a bad way. I learned a lot about a few people last live. And, hopefully that'll be able to help somebody, push through whatever they're going through in life, especially nursing school. Okay. Either it be a LVN or LPN, because everybody's a nurse. It says it in their title. LPN, licensed practical nurse, RN, registered nurse. All right. So we ain't going to be acting like a fool up in there. So like I said, make sure you guys make sure you guys share. Okay. So here we go. Who's ready for some NCLEX questions? I'm just going to jump straight into it. Usually I'm up in here running my mouth, but people don't want to hear me today. So, today's Wednesday. Today's hump day. Who want them? Who want them? All right. I'm about to transition over here because, it's ghetto out here. TikTok won't let me be great. And I can't I can't stream from the computer because it won't let me be great. And somebody got mad at me because I banned them last week, or I banned them on Monday because they wanted to act a fool. And then they sent something up to TikTok saying that I was harassing somebody. I don't know how I'm harassing nobody, and I'm motherfucking who's hosting it, but whatever. Yeah, I need 10,000 people to follow me. So the more y'all share, the more people follow me. All right, more beneficial it could be for y'all and for me. So yeah, we're gonna jump into these questions right now. So give me a second because I gotta move this ghetto-ness over here. Move it over. All All right, let's see what's going on here. And there we go. All right, cool. Everybody can see that? Can everybody see that? Who can't see that? Who cannot see that? Everybody should be able to see it. I can see it. I can see it from here. Shout out to all 57 of y'all. Hey, so if you're new here, welcome. My name is Kevin. My name is Kevin. Shout out to y'all. Welcome. We're doing the live stream talking about NCLEX questions today. We're doing pharmacology. I only got 20 for y'all today. 20 for y'all, and that's all y'all get. So yeah, one thing I want y'all to do is I want y'all to participate because, I'm kind of, sort of, but not really, but really funny. It all just depends on your sarcasm, if you like me or not, but I don't care if you don't like me because that's just not what I'm here for. I mean, I want y'all to like me, but if you don't, that's cool too. The more you like, the more you get. We got 20 questions, but I might have some surprise ones. So the more y'all like, the more you get. If I don't get at least how many likes did I have last time? I think we had like 40 or 50,000 likes. Y'all better smash that button. Y'all better smash it. Yeah, we're only doing 20 questions today. Only 20. This is a continuation. What's up, Sandy? We only got 20 questions today because this is a continuation from Monday because I had to get off. You telling me to hush? What I hush for? What I do? So make sure y'all share. Make sure y'all smash. You better give up 25. That seems a little aggressive right there. I don't know how I feel about somebody being aggressive towards me, but we'll see. We'll see how I feel in the end, AJ. We'll see what's up. All right. So shout out to y'all. Yeah. So make sure I smash. Hey, I need 10,000 followers so I can stream from my computer because this is ghetto. Give us 50. Look. So technically this was your 50, but I got tired. I was busy on Monday and I got super tired. So this is the continuation. Monday was 30. Today is 20. You get 50. There you go. 50 within, look at that. Just think about 50 within a day. You Gucci now. Hey, I need 10,000 people to follow me. So make sure you guys share. I had 118 people share. I need all 87 of y'all to share right now. Let's do it. Let's make it happen. Hey, I'm always going to talk about my NCLEX course, right? NCLEX course, 7-day NCLEX course is in its pre-launch phase. The link is in my bio. It's in the link tree. Make sure you guys check that out. Okay. It's in its pre-launch phase, which means that we're still updating it. So it's incomplete, but you're going to get it for $48. $48, 80% off the current price. Once you get it, you have it forever. So if you're an LPN and then eventually you're going to go RN, you're going to have an NCLEX course that's never going to go away. So make sure you guys check that out. Okay. If you troll my chat or if you act a fool, I'm gonna give you a 600. A 600, you may ask, what is that? That is 60 seconds. I'm sorry, that's 600 seconds, which equals 10 minutes, and that's how long I'm gonna ban you. Hold on, somebody's telling me my camera's blurry. Give me a second, because we ghetto out here. Hold up. See, I never would have had this problem if TikTok would let me be great. Oh my God, that's as clear as day. Look at that. Money. All right, hey, but so essentially, if you troll, I'm going to ban you, and if I don't ban you, somebody down there is going to ban you. All right, I'm sorry, Manasa, you guys. If you guys don't know who Manasa is, she's a nurse, hanging out, got her master's degree. Hey, as a matter of fact, Manasa is one of those individuals that I coach. What's wrong with my mic now? Yeah. How's that? Is that better? Does it still sound muffled? Let me know. But I don't want to go on. Okay, good. All right, cool. Beautiful. All right, cool. Good. Because y'all already know I'm lost without y'all. All right, cool. We about to jump into the first one. Let's see what's going on. All right. Which of the following statements is true about combination therapy for the treatment of HIV? Hey, remember, I want y'all to participate. All right. A, it completely shuts off replication of HIV. B, it's the only FDA approved treatment for HIV disease. C, it appears to cause a sustained benefit achieved by drug number 1, preventing the emergence of resistance to drugs number 2, despite resistance to drug number 1. Or is it D, it's only effective if used alternatively with periods of monotherapy? What are we thinking? You say C. Who is that? Sandy says C. Okay. Been an LPN for years, thinking about going to be an RN. Go do it, Lori. Every time I think about Lori, you ever seen that 70 show? I'm like, Lori. Hey, but go do it. Honestly, I used, who's that? Chris. I used YouTube a lot for Patho. And I like Patho. Patho was great. The disease processes and how they affect the body. Everything is a trend. Every single thing is a trend. And you just need to know how it affects the body and how to follow it. All right. So I got a bunch of people saying C. I got 76 people up in here, but I don't got 76 answers. Hey, I'm gonna need for y'all to hook it up. Vane said, I'm back. Hello. I enjoyed your live the other day. I appreciate you being here. A is wrong. Okay. A is wrong. What's the right answer then, AJ, since A is wrong? What is it? What is it? What is it? B is wrong. Okay, you don't have to tell me what's wrong. Just tell me what's right. Roland Vane says C. Okay. All right. I said C. Oh, did you? I didn't see it. All right, cool. So looks like we got a good understanding. Got some people saying C. Rhonda says C or D. I'm leaning towards C. Okay. I just received my temporary license for RN studying for my NCLEX RN. Shout out to you, Kendall. Chris says C. AMA join nursing. Just here to. Okay. Hey, I'm glad that you're here to prepare. Make sure you follow. Make sure you follow so you can always be prepared. Hey, if you stay ready, you never got to get ready. All right, here's the answer. All right, the answer is C. It appears to cause a sustained benefit achieved by drug number one, preventing the emergence of resistance to drug number two, despite resistance of drug number one. That's a mouthful, to be honest. But hey, majority of y'all got that right, so I appreciate y'all. The combination therapy is superior to monotherapy at this time for reasons described in this choice. This form of therapy is recommended for all patients with HIV by the Department of Health and Human Services and the World Health Organization. This daily treatment of multiple HIV medications is an HIV regimen. All right. So here's the thing: is some of these are going to look wonky, some of these aren't going to look so great, but that's okay because not all NCLEX questions are built or are the same. So just be ready for that. Also, I don't gatekeep. A lot of people are just like, hey, where'd you get these questions from? These questions came from nurseslabs.com. So if anybody wants to go take a look at those, you can go take a look at those as well. These are not necessarily the next generation NCLEX style type of questions. However, these will still get you prepared in the mindset of studying for your exam because they still have multiple choice questions. They still have select all that apply. They still have all those questions that are there. Okay. Can you do fundamentals of nursing, pathophysiology, and health extension? I'm not doing them today. Not doing them today, AJ. I'm just doing pharmacology. But we could probably do fundamental questions on Friday. We can probably definitely do some fundamental questions on Friday, but I'm not doing any questions like that today. Just pharmacology. Giselle, yeah, that's what we're doing. We're doing pharm. That's what we're doing. Second largest section on the NCLEX is pharmacology. All right. Question number 42. When administering topical ophthalmic preparations, the nurse must assess what? Visual acuity, intraocular movement, color of the sclera, or blinking reflexes. Which one? So obviously this is telling me something about the eyes, right? So you're saying C with a question mark, Sandy? Come on now. You got to give me something. You got to give me something more definitive than that. Yes, I'll be there Friday. Was about to ask what? I don't know what you're. You say, Ali, oops, says color the sclera. Okay. AJ says D. You put it on the lid and then you blink. Okay. Giselle says B. Is it Jeannie says A? Jeannie says A. Hey, shout out to all 68 of y'all that are up in here. Make sure you guys smash that like button. Make sure you guys share as well. Make sure you guys share. I had 118 people share last time. What's wrong with y'all? No. B. AJ says, no, you don't. Okay. All right. All right. All right. What we got going on? What we got? I'm just guessing. Okay. So here's the thing. Remember, when you guys are answering your questions and when we go to read the rationale, always read the correct answer, but then you always want to read those questions that are incorrect or those answers that are incorrect so you know why they're incorrect. All right. We got C, got A, got a bunch of C's and a bunch of A's. Got a bunch of C's and a bunch of A's. All right. Let's see. I'll give you guys a couple more seconds to see who else wants to answer. What else we got? Corn Dog. Shout out to you, Corn Dog. Thank you for the follow. And shout out to everybody else that just gave me a follow too. Imperfect Nurse says A. Is it Aja or Anja? Says A. Liza says C. Timmy says A. All right, cool. Let's see what the answer is. The answer is A. Visual acuity. The nurse must assess visual acuity, extraocular eye movement, tearing, and discharge when administering topical eye medication. Topical ophthalmic medications are widely prescribed by growing numbers of eye care professionals. Increasingly, these agents are being prescribed by optometrists and ophthalmic trained nurses, in addition to ophthalmologists and general practitioners. As the number and variety of topical agents on the market rises And as the number of clinicians involved in prescribing these agents increase, the risk of systematic adverse effects will also increase. What? I know, it's crazy, right? Oh, I said D was so close. Thanks for explaining. Yeah, no problem, AJ. So that's what I'm trying to tell you guys is that it doesn't matter what test bank you buy. It doesn't matter where you get your questions from. This is the correct answer, right? I don't make the rules. I don't make the rules, right? So it's just that's the correct answer. And then you have your other options over here, and you need to read these in order to find out why they weren't the correct answer based off of the question. Okay. And then that way you'd be so surprised by you reading these incorrect answers. And while they're incorrect, that maybe 5-10 questions down the line that you would have another question that would just be rewritten differently. Okay. All right, cool. I think everybody's got a general consensus of that. So we'll go on to the next one. All right. So like I said, this is a continuation from what we did last week. So wait a second. Hold on. I think I gypped y'all. I sure did. There we go. We're going to go back. What's up, Masterpiece? I gypped y'all. I started y'all at 40. Well, I should have started y'all at 30. You already answered a few of them, so it doesn't matter. So we'll go on. We'll start back at 31. So, all right. Anti-tuberculosis therapy may be determined ineffective when what? Sputums are negative, symptoms resolve, hepatitis results, or bacteria or drug-resistant bacteria emerge. Which one? Let's see. All right. What we got? What y'all thinking? Let me know. Okay. D. All right. It looks like just D everywhere. Throw some D's on it. I'm waiting for somebody to say something else. All right, cool. Here we go. Let's see what the answer is. And the answer, of course, is D. Shout out to all y'all. Y'all got the answer right. The emergence of drug-resistant bacteria indicates that I always mess this up. I'm trying to kind of chill out because if I say bad words, people are going to get mad at me. I say anti-tuberculosis therapy is ineffective because the drugs are no longer ending bacterial manipulation. A feared complication of tuberculosis therapy is multi-drug resistant tuberculosis. So that essentially, obviously, that means that no drug is going to get rid of the tuberculosis. So it's distinguished by its resistance to first-line medications, ionizing and rifampin. Therapy for the MDR-TB is steadily advancing, and suggestions are continually changing. All right, so shout out to all y'all. Yes, got me. Yes, go me. Okay. I will take this class next semester. In my first, hey, pharmacology is a monster. I'm just letting y'all know. Regardless, it doesn't matter if you're going LPN or if you're going RN. Pharmacology is the same in regards to if you're going RN or LPN. It's just as an LPN, you need to know what you can and can't do. Like you can give sub-Q, you can give IM, you can't give IV medications, right? As RN, you can do all of the above, right? I'm a BSN RN student. Okay, shout out to you, AJ. All right, here we go. Next question. Fluconazole can be administered to a client with what? Is it pneumococcal meningitis, oral thrush? Is it cryptococcal meningitis or pneumococcal pneumonia? Hospice said, you said N? I don't know what N is. What do you mean? What do you mean? Tell me what you mean. I don't take this class until next year, but I'm here for friends who are in that class. Hey, even if you don't take this class till next year, there's nothing wrong with being kind of the head of the game and kind of seeing. Stop saying, what do you mean N? Oh, you mean B. Okay, I got you. I was just like, ma'am, that ain't even an answer choice. Yeah, fingers. Big old sausage fingers. Caitlin says B. Is it Dinesks? Dinesk says B. Ty Baby says B. Ty Baby. Slim Fiji says B. Okay. Shout out to all 130 of y'all. Hey, I appreciate everybody for jumping in. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys share. Hey, I need at least 20,000 likes. Hey, I may have some extra questions for you. I might, but I guess if nobody wants them, then I guess they won't get them. Took the NCLEX and still don't know what this answer is. That's fine. Landon. That's all right. Because here's one thing I'm gonna tell you is that just because you take the NCLEX doesn't mean you're not supposed to be an expert. Even if you were an expert, they're going to start throwing out questions that you've never heard before. And if you start seeing that on your NCLEX, you could probably just pretty much say like, "Hey, I think I'm doing something right." The answer is B. Says the Lash God. Ivy says thrush. Hunter says D. Okay, B. And I've been a nurse for 12 years. I don't know what that means, Ellie. Does that mean that you got the answer right or you got it wrong? I don't know. I'm just asking. All right, here we go. Here's the answer in 3, 2, and the answer is C. It is cryptococcal meningitis. This drug is given for the treatment of cryptomeningitis. The combination of amphotericin B and is it flucytosine or flucytosine? I'm sorry, has proven the most effective measure to clear the infection and showed a greater survival benefit over amphotericin alone. However, due to its cost, it's often unavailable in poor resource settings where the disease burden is sufficient. A and D are incorrect because pneumococcal meningitis and pneumonia are not caused by fungal infections. Wow. I know my dad had crypto, was it neoformans, luckily caught before. Hey, shout out to y'all for, who is that? Mama who? Mama of Caden and Kinsley. Hey, shout out to y'all for catching that because we already know once it gets to the brain, it's like it's over and done with after that. So that's great that y'all caught that for sure. So thank God for Lexicom is in this area. All right, Caitlin. All right, Gara. Gabby says, "Wow." Why you say wow, Gabby? Hey, shout out to all y'all. Hey, make sure y'all smash that like button. We getting through it. Shout out to all y'all. Hey, make sure y'all participate. All right. Here we go. Question 33. When administering amphotericin B, which of the following must be used? A brown bag to protect the infusion from the light. A diluent of 5% dextrose with no preservatives. A diluent of normal saline with alcohol. Or a micron fiber of above 1 micron. Yeah, Gabby, you learn a lot about if you've never taken pharmacology, and trust me, I haven't taken pharmacology in years, but most definitely, like, there's some things about medication that we know as nurses that, we don't know, like, when you start to advance in nursing. So, like, anybody that's going to end up being an MP or go get, like, a nursing educator or get a master's degree, you'll learn advanced pharmacology, and those are the things that you're going to learn, too. Like, you're like, wow, that's crazy. That's cool if you don't know. If you don't know, that's cool. Hey, you know what? When you're on your NCLEX, you can't say, I don't know and not answer. So if you don't know, just pick an answer. If you don't know, pick an answer. Got most people over here look like they're saying A, which is cool. Is it Jake Quellen? I'm sorry. Jacqueline says A. UA says B. Colleen says B. GG says B. Okay. All right. UA says B. Okay, I saw you. Is it Milan? Milan says B. Kendall says D. Okay. I just passed step 1 of med school and we're not taught this. Hey, look, you'll know. No, you'll know eventually. Miss Parker. I'm sorry. She picked D. Okay, is it Ryan picked D? AJ picked C. Got A. Got Sandra picked B. All right, looks like we're kind of all over the place. Cardi. Hey, look. Cardi, she said that y'all were targeted in med school. Hey, I'm just saying. All right, here we go. We'll give y'all this answer in 3, 2. The answer is B. A diluent of 5% dextrose with no preservatives. Man, amphotericin B must be mixed with a solution with no preservatives. It can act as both an acid and a base and virtually water insoluble. It is not absorbable via oral or IM muscular administration. Needs to be. Got it. Shout out to y'all for getting it. Hey, look, pharm is a monster, yo. Pharmacology is a monster of just, a subject of trying to learn everything. Like, not even gonna lie to you. So, yep, knew it. Yep, I'm glad you knew it. Hey, shout out to all 135 of y'all. My entire NCLEX was pharm. Look, I'm telling you, pharmacology is the second largest section on the NCLEX at like 18%. The largest section is management of care, which is at like 20%. So, Hey, if you love pharmacology, hey, we had a pharmacist or somebody who was in pharmacology school that was in here last live, and they were getting them all right. And I was like, look, you just need to start teaching everybody else about pharmacology. But remember, this is pharmacology from a nurse's standpoint, but the majority of everybody who's doing this needs to know it as well. So was mine, and they pulled out drugs I've never. Exactly, that's how it happens. All right, question number 34. Which of the following nursing diagnosis might occur when administering a large parenteral dose of amphotericin B with vancomycin? All right. So think about what vancomycin is, what type of drug it is, as well. And remember, it's a mycin. All right. So, and same thing with amphotericin B. Like, what type of medication is that? So think about, like, what are the things that we're going to be looking for, especially with vancomycin? Decrease cardiac output, ineffective airway clearance, ineffective breathing patterns, or fluid volume excess. What are we thinking? What are we thinking? Shout out to all 100 of y'all that are hanging out. Y'all smash that like button. Make sure you guys share. I appreciate it. Colleen says D. Okay. Ali says D. Okay. Edema. Okay, Sandy. Okay. Okay. UA says D. All right. Mackenzie says C. Sandy says D. Yeah, I heard you. Raya says D. Definus, I'm sorry, says D. AJ says A. Because Red Man Syndrome, I'd go D. Okay. Okay. Not a lot of people know about Red Man Syndrome. Trust me, when you'll know it when you see it, or when you're talking to them and they can't hear you, they're like, what? I had that happen to me once or twice and it flew over my head. Kidney issues. Okay. D. PJ says D. Okay. Shout out to all 150 of y'all. Ototoxicity. Okay, all right. We thinking a little bit deeper using that critical thinking in regards to especially vancomycin, right? Especially vancomycin. All right. Looks like we got a general consensus. A lot of people pick D. So let's see what the answer is. Oh, the answer is D. Hey, by the way, I just hit that button. Didn't even realize it because I was just reading y'all's comments. Oh my God. All right. These two drugs are both nephrotoxic. Nephro meaning kidney, toxic, obviously, toxic, poisonous, right? So the nursing diagnosis may result from renal problems. Renal toxicity correlates with conventional amphotericin B use and can lead to renal failure and requirement for dialysis. All right. So, yep. Let's see what else. But the azotemia often stabilizes with therapy, and renal damage is reversible after discontinuation of amphotericin B. Avoiding is it concomitants? Bro, I don't even know. I'm going to say concurrent use. We'll say that. Use of the other nephrotoxic agents and appropriate hydration with normal saline may sufficiently decrease the likelihood of having like a severe reaction with amphotericin B. Lord have mercy. Pharmacology, look, I don't care if you don't know how to pronounce it. As long as if it looks familiar to you and you know what the signs and symptoms and what the pharmacokinetics and the pharmacodynamics of it, that's all I care about. That's all I care about. So if you got a problem with me saying it, don't care. I'm just playing. I love y'all. Make sure you smash that like button. Y'all share. Here we go. All right. Question 35. Arvik, who names their child Arvik, who, whatever. No shade to anybody that names their child Arvik. A 60-year-old student has acquired a systemic fungal infection. He should be treated with what? Amphotericin B, miconazole, is it ketoconazole, or is it glycopholfin? Glycopholfin. We'll go with glycopholfin. I'm pretty sure I said it wrong. Easy. Rochelle said easy. Rochelle, I ain't seen you answer nothing except for the first one and now this one, and you telling me it's easy. Ma'am. Psych. It's gotta be A. Gotta be A. Okay. What else we got? What else we got up in here? Gina says A. Okay, Gina. All right. PJ says C. Gabby says A. All right. AJ says B. KK said, I'm thinking C. You thinking C or you know it's C? Amanda. That's hilarious. She says B. Truly says A. B is the answer. All right, Jody. Jody, you gonna die on that hill? You gonna die on that hill? Like B is the answer? I'm just asking. B and C? It can't be B and C. It has to be one. Which one's better? My service been acting up to sure it has. Keyword systemic. Love it. I love how you said that. The key word is systemic. Okay. Rochelle says A. Okay. Zoe says A or C. All right, well, let's see what the answer is. Let's see what the answer is. The answer is A, amphotericin B. Serious life-threatening fungal infections are treated with amphotericin B. Like I said, the key word was systemic, right? Amphotericin B belongs to the Pauline class of antifungals. It is also known to be the name conventional to the, I'm sorry, it is also known by the name conventional amphotericin B and has been in use of treatment of invasive fungal infections for more than 50 years. It was first isolated as a natural product of soil. I'm not even going to try to pronounce it. I'm not even going to try to pronounce it. I will mess it up. Archer's pretty good. Archer has good questions. I think UWorld actually has pretty good questions as well. However, with UWorld, I think that they're too expensive and too they don't have all they have is just questions and answers and like rationales. And I always believe that people need more than that. That's just me though. There's a lot. These are some long explanations. Yep, there are. So even if you use UWorld or even if you use Kaplan, if you use Simple Nursing and all those other ones that are out there. They have some pretty good linking ones too. What do you think about purchasing Simple Nursing for studying? I mean, I think that they're pretty good. I think they're pretty good. I don't sit here and I don't shit on anybody. I like Nurse Mike. I like his YouTube channel. He's like his YouTube channel for especially cardiac meds. I loved a lot. So I love the long rationales. It's what sticks in my head. Yeah. The thing about it is like you don't want short rationales. You really don't. I agree with you, World. It's a go standard for STEP though. Wish it taught more. I know Kaplan teaches STEP as well. I know Kaplan teaches a whole bunch of other stuff. So, but it really just depends on you and what you want. All right. Oh, look at that. Hey, shout out to all 92 of y'all that are up in here rocking with me. Shout out to everybody that's sharing. Make sure you guys keep sharing. Make sure you guys participate. I appreciate all the participation. We're doing NCLEX questions, specifically pharmacology. I don't, like I said, it's down there at the bottom. I'm going to skip to it right now. I don't gatekeep. I got these questions off nurselabs.com. So if you're a brand new nurse and if you're trying to look for something that's free, go over there and look at them. I look at them. I like them. That's why I bring them here for y'all. And of course, I love the participation and you guys answering the questions, but you guys can also answer each other's questions down there as well. And that's what I love. So is Archer better than UWorld? It all just depends on you. Like some people, like both questions, I think they both have the same thing. So a lot of people are like, hey, what's better? I mean, honestly, it just depends on you. What type of learner are you? And it's not even just about, I can give you all the tools for you to be successful, but if you don't use them properly, like UWorld has been proven to work for like 96% of people that have taken it and they've passed. But I didn't pass when I used it. Same thing with Archer, like 94, 96%. I didn't use Archer because I didn't use it. Kaplan, like 97%. I used Kaplan. It worked for me. Simple Nursing has those good. I mean, it depends on what works for you and where you are in your life. You know what I'm saying? Like I use UWorld. People swore by UWorld and I failed. Now it's just like, okay, I don't like this. I didn't know you left, Cassie. I didn't know you left. So I'm just saying it all just depends on you and what you want to do. Archer is cheaper than UWorld and you get more with Archer. I'm just being all the way honest about that. Did anyone else school saying HCI to Elsevier? So I had Elsevier, which was Hesse. Didn't like it at all. I mean, I don't like Hesse at all, and that's just me. Hey, so by the way, the more that you like, the more question that you get. I'm just saying. I may have more than 20 questions, but if I don't get more than like 40,000 likes, it's probably not going to happen. Because look, y'all setting the standard. Well, we'll say 20,000. Like I won't even be greedy like that. But I'm just saying, I hate Hesse too. Like I ain't even gonna lie to you. Well, was you on live? I was live the other day. I was live on Monday. Yep, I surely was. We use Evolve. Evolve is Elsevier. Same thing. Yeah. So make sure you guys smash that like button. Hey, dish them out. I want 1 million likes. I want them all right now. Give them to me now. I love you. Make sure you guys share because you never know who this is going to benefit for. Views on ATI, don't like it at all. It's fucking terrible. That's just my opinion. Same thing with Hesse. It's terrible. It's a racket. Like all that shit is a racket. It's stupid. But I need 10,000 followers, y'all, so I can stream off the computer so I don't have to like wipe my screen. It's ghetto. Why? What? DeWood, why? I'm assuming you're asking me like why don't I like ATI? I don't like ATI or Hesse is because they don't, in my opinion, and this is my opinion based off of myself and we'll say the 30 people that didn't pass that exit Hesse, which was half of my class. It doesn't prepare you for NCLEX. It did not prepare me for NCLEX at all. Passed my NCLEX in July and I didn't have any dosage count. Look, neither did I. But my first 3 times I took my NCLEX. Oh, by the way, hey, y'all, I failed my NCLEX 3 times. Yep. I tell y'all that now. And I'm still here making it. Why you say damn? Hey, I need 10,000 likes. I need 10,000 follows. Make it happen. Monisa failed 6 times. As a matter of fact, Monisa was one of the individuals that I coached, and she passed on her 7th attempt. If y'all don't believe me, y'all can go check my YouTube channel, which the link is in my link tree. If you don't believe me, you can go check my Instagram. You can go check everything. I've been coaching Monisa. Like, she reached out to me a long time ago, and we've been cool ever since. And she just got her master's degree, y'all, in like May, after failing 7 times. Or failing 6 times, I'm sorry. You see what I'm saying? I failed 3 times and passed on the 4th. Who was that? Pocahontas said something about, thank you for being honest. Look, hey, that's all. Look, I don't gatekeep, and I ain't got nothing to hide in regards to this, right? Because this exam doesn't determine what type of nurse that you're going to be. Only you do that once you get out there. All right. So I'm just saying, I'm just keeping it all the way real. I take my NCLEX this week, and I'm terrified. Don't be terrified of it. Don't be scared of it. Don't be scared of it at all. I wasn't. That's why I kept going. Monisa wasn't. That's why she kept going. If Kadeem was in here, he'd tell you the same thing. If Jason was in here, he'd tell you the same thing. All right. I'm always going to talk about my course, the 7-day NCLEX course. It is exactly what you think it is. It is an NCLEX course. We're currently building it right now. It's in the pre-launch phase. That link is in my link tree in my bio. It's going for $48. Once you get it, you get it forever. So if you don't take your NCLEX for another 6 months to a year, to like 2 years if you're in school, what better thing for you to tell somebody, hey, I got an NCLEX review for freaking $48. You know what I'm saying? And once you have it forever. So all the updates, all the content that I'm recording, all the NGN stuff that's going to be coming in there, look, you're going to get it, and you're going to get it all. You feel me? So make sure y'all go over there and check that out. Hey, don't troll in my chat. Don't act up in my chat. I got moderators that know exactly what I'm looking for. If you come in here acting a fool, you're going to get a 600. What's a 600, you might ask? A 600 means 600 seconds, which equals 10 minutes. And that's how long I'm going to ban you. But I won't ban you for 10 minutes. I'm going to ban you forever. So I don't want you coming up in here acting a fool. Constructive criticism is good, but being an asshole, I'm not going to tolerate. The only asshole is me. I'm just playing. I love y'all. Shout out to y'all. 7,000. Hey, keep it pumping, baby. That's what I'm talking about. Also, like I said, I don't gatekeep. If anybody want to know where I got these questions, that's where I got them from, the nurseslab.com. It's also really good if you're a brand new nursing student looking to do NANDAs, like when you're in fundamentals, trying to learn about your nursing diagnosis, so on and so forth. It's Gucci out there. Make sure you guys shout out. Oh, and by the way, you act a fool up in here, and if I start picking on you, you getting the finger. Like right now, the finger is for Sandy because she pointed it out. You act up, you get the finger. Sometimes you get 2 fingers. And you see what I'm saying? Let's do it. I start fundamentals this week. Hey, shout out to you, Tess. Hey, fundamentals is what we call the nursing school killer. It is the weed out. So if you can't hack it, fundamentals will let you know. What do you think about Mark Clemick? I love Mark Clemick, 100%. Mark Clemick especially was the main reason that I decided, one of the main reasons why I was just like, I need to do a review, because I am also an instructor. I've taught in a surgical technology program for 3.5 years. I did a whole bunch of other stuff. I've been an educator for 8 years. I'm also a trauma nurse. Instructor. So the more that I taught and the more that I listen to Mark Clemick teach, he and I teach, the relevancy of how he and I teach is almost identical. And I love it. And I was like, you know what? I don't want anybody to ever feel how I felt and feel like they were a failure and that this test is better than them, because that's not the truth at all. When you pass, no one at your job or no one's ever going to ask, hey, how many times did you take the NCLEX? Oh, you failed 7 times? Get away from me. Doesn't matter. Doesn't matter at all. Trust me when I tell you that. All right. Shout out to you, Jason. What's up, Jason? Riley's up in here. She says, C, I failed the F out of the respiratory test. I mentioned too. My whole class did ABGs. ABGs are a monster, right? Right? ABGs, you got to know your pH, your bicarb, your PaO2, PaCO2, right? O2 saturations, right? We got B. Erica says C. I ain't even read the question yet. Y'all are already doing it. I'm going to read it anyway since I ain't read it. Which of the following must always be present before beginning antifungal therapy? Coagulation profile, confirmed diagnosis, biopsy of the infected site, or your analysis. We got B's, got some C's. I just did a whole presentation on ABGs last week. How'd that go, Jess? Hello. Was it failed 2 times my boards and getting ready again? That's what I'm talking about. Hey, so that's another thing I'm gonna say as well. We got B, 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 C. That's another thing I'm gonna say. If you failed your NCLEX and you tell us in this chat, the only thing that better follow that statement better be, I'm taking it again. That I better not hear nobody say I'm scared. You better say, hey, I'm taking it again. Even if you do say I'm scared, it better be followed by I'm taking it again. Got C, buy up. Okay. Got C. Some people said B. Okay. Got 100 and 100. I'm super proud of myself. Took me some time to understand. That's all it took. Everybody has a different level of learning, and that's it. Failed 3 times, and I'm taking it again. That's what I'm talking about. That's all I want to hear. E, all the above. Jacob, don't come up in here doing that. Don't do that. We are here to help you if you fail. Facts. That is why this community, that's why I do these lives, is so for us. All right, Natalie, if you're asking me a question, you better put like a smiley face at the end of it, because I'm going to assume you're yelling at me. So we're about to find out what the answer is. Who getting no, Sandy, who are you talking about getting a 600? Wait, hold on. Who are we talking about? So the answer was B. Confirmed diagnosis. All right, cool, Natalie. We good. Yes, I knew it was B. Shout out to you, AJ. The diagnosis of fungal infection as opposed to infection such as by viruses or bacteria is necessary before beginning therapy with antifungal agents. Clinically, fungal infections are best characterized by first, according to the site and the extent of the infection, then the route of acquisition, and finally, the virulence of the causative organism. These classifications are essential when determining the most effective treatment regimen for a particular mycosis. I know that's a mouthful. I wish I could make that easier, but it's a mouthful. So let me see what you guys are talking about. So antifungals aren't no, they're not. Hey, shout out to everybody that's liking. Shout out to everybody that's following. So who followed me? Kira followed. Thank you, Kira. Jessica with a Z. That's different. Patricia, shout out to all y'all for the follows. I love it. I failed my NCLEX. I'm upset, but I'm going to pass it next time. I promise you that. I appreciate you. Look, Jimmy, that's what we're here for. You will pass it. Hey, put it into existence and it shall be so, right? Hey, if anybody watched college football that happened this weekend, Deion Sanders said to his team, he was like, believe. He was just like, I believe. If I believe, it shall be so, right? Everybody in here has a pen, right? It's up to you how you want to write this story, all right? I need help with chronic care, first exam in a week. With chronic care, Riley, come on. Fungal infections are treated differently than a viral and bacterial infections. Yes, they are, 100%. I like this kind of energy. Isabella. That's my niece's name, right? That's my niece's name, Isabella. Wait, hold up. 254? Isabella, where are you from? You from Killeen? I think we got somebody up in here from Killeen. Shout out to y'all. Rochelle says A. All right, Isabella, I see you. Go Buffs. That's what I'm saying. Cuba, like Guantanamo Bay, Cuba. I've been there before. All right, here we go. Question 37. Which choice describes the action of nucleoside analogs? Is it A, exert anti-HIV activity at the reverse transcriptase level and cause premature termination of a viral DNA chain synthesis? Or is it B, completely stop the replication of HIV virus? Is it C, allow for a patient to become non-contagious after taking for at least 3 days? Or is it D, are all equally effective and free of side effects? What do we got? Got A, failed my first semester. Now I'm in my second semester, a little progress. Look, let me tell y'all something. I almost didn't even make it out of my first semester. I needed a 75 to pass and I got a 78. Fundamentals was a monster. And it was only a monster because I made it hard on myself, right? Because for those that also don't know, because you can't see my face, I've been in the Navy for 16 years, all of it being a hospital corpsman, a surgical technologist, and an instructor. So I'm a master instructor in the Navy. And so I had a very hard time in fundamentals because I had to turn off hospital corpsman. I had to turn off LVN and I had to apply RN because that's what corpsmen are in regards to, medicine in the military. So I had a hard time. I have an Army medic in my cohort. So I could do all the hands-on stuff. It's just when that fundamentals will humble you. Fundamentals equals humbling. Believe me when I tell you, it will humble that ass real quick. I failed med surg by 1 question point. That's terrible. Been holding the grudge ever since. Hey, Rochelle, you're only in order for you to really like stunt on them is to pass that fucking class. That's it. Start a med surg and farm next week. Shout out to you, Jess. Shout out to you. Hey, that's the only way that you can really just like put it in their face is just be like, hey, I passed. Now what? Because I can tell you right now, no one's going to come up to you. No one is going to come up to you and just be like, hey, I heard you failed pharmacology. You're dumb as fuck. No one's going to say that. No one's going to say that at all. All right, let's see what the answer is. All right, so the answer is A. Exert anti-HIV activity at the reverse transcriptase level and cause premature termination of viral DNA chain synthesis. This choice correctly describes the action of a nucleoside analogs. They were the first class of antiretroviral drugs to be approved by the FDA. They're taken as prodrugs and must be taken into the host cell before they can become active. Once inside the host cell, cellular kinase will activate the drug. The drug exerts its effects through its structure. I got that right. Let's go. Let's fucking go. That's what I'm talking about. I'm sorry. I don't know why I'm yelling. I'm like right here next to the mic. So I probably like got y'all all muffled and stuff. So, hey, shout out to y'all. Hey, shout out to y'all for killing that like button. Shout out to all 22 likes, 110 of y'all up in here. Hey, if you're new, my name is Kevin. I go by the Boot Nurse on all social media platforms. And right now we're doing NCLEX questions specifically in pharmacology. So I want to know who you are, where you're from, where you're at in your nursing journey. You took the NCLEX, you about to start school, you in school. Like, what we doing? Let me know. We got a bunch of folks that's in there, right? My co-host, I think Nurse Nelly might be in here. Been a nurse for 4 years. She'll answer your questions. She does case management right now. Jimmy, Delaware. Jimmy, you were the one who kept saying for me to go to Delaware. Ain't nobody going up there. It's about to get cold too. What's wrong with you? And then we got Manasa up in here. Miss, I just got my master's degree, and she's been a nurse for what, a little over a year now, working at med-surg, doing her thing. Got her master's degree in nursing leadership. So I already know she's about to be stunting on everybody. All right, whatever questions you guys have, she can answer them too. Why is it that I'm dancing from getting it right? That's all right. I need to get right with Jesus. No, hey, it's a good dance though. It's a good do your little dance. 12K now. You can do live. No, I need 12,000 followers. Took my LVN, NCLEX and Del. Oh, okay. I got you. Hey y'all, Isabella. I live in Vegas. Shout out to Vegas. Getting ready for my NCLEX after failing 2 times. Bella, that's what I'm talking about. I failed my NCLEX, but that ass better go take that exam. I'm in farm and maternal. Now, 2 more terms to go. That's what I'm talking about. Alexis, are you saying C with a question mark because you can't tell me? You better tell me C with some definite, it being definite, right? Which of the following is true about protease inhibitors? Works better when used alone, are the same as nucleoside analogs, affect replication of HIV at different stages than nucleoside analogs, or has a high level of toxicity. Use Simple Nursing and Archer and you will pass. Well, it depends, Mark. Mark Best Sport Pits. It all just depends. I used Archer. I thought it was okay. I thought Simple Nursing was okay. But 1, you don't understand people's finances. And 2, you don't know how people learn. Not everybody's going to learn the same as you do. So I do not see I can like the live. You just have to tap. Like, you just got to exactly like that on the screen. And that's how you can get the likes. All right. So that's another thing I'll tell you guys is like everybody learns differently. If you notice in school, they have a standard. Like they're going to tell you to open up the book. They're going to tell you all to take the same notes, or they're going to give you the information, but it's up to you on how you learn. So are you a read write? Are you kinesthetic? Are you auditory? Are you a visual? Are you are you a combination of all of them? So it all just depends. What were your scoring on Archer, if you don't mind me asking? I don't know if you're talking to me. What about Hearst? It's more so interactive. So I thought Hearst was okay. I just thought that for me with Hearst, I could not get over the accent. So the Hearst that's out right now, it's very different from the Hearst that I took because I graduated in 2018. So I had the Hearst from like 2017. And, Aunt Marlene, y'all, and that country ass Mississippi accent, shout out to anybody from Mississippi, but that accent was an environmental distraction and I could not do it. So I ain't mad at her, Southern Belle and everything. Hey y'all, and Marlene. Same thing with Nurse Sarah, right? Nurse Sarah from Registered Nurse RN. I hear it. I'm telling you, I'm from the South. I live in Texas, so but when I'm telling you, like I could not do. I was laughing. I was falling asleep. It just wasn't working for me, right? I'm just saying, Nurse Sarah, she out there. So not sure at where you got the bank is, but it's amazing. I appreciate. Is it Nicaria? Nicaria? Is it Nicaria? Can I call you Nikki? And it's all because of Nikki. All right. Anyways, what whiteboard? Oh, that whiteboard can be. Yeah, it can for sure, 100%. All right. So the answer is C. Effective replication of HIV at different stages than nucleoside analogs. All right. Remar nursing is amazing as well. Remar's pretty good. Miss Regina Callion, MSN. She's the I used her for motivational Mondays. I actually still look at her stuff every so often. So these other people that do these NCLEX reviews are they are my motivation. Like I love looking at their stuff. Protease inhibitors. I'm not going to read this, but you guys already picked the answer, so we'll go on to the next one. We're just over here chit chatting. Shout out to all 50 y'all that are in here. All right, question 39. Here we go. The human cells specifically, the human cells specifically affected by HIV are gonocytes, CD4T, isolate cells or red blood cells? B, 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 B. Have you used the program? So, I'm talking about. So by the way, I've messed around with Archer. I like Archer stuff. I like Archer stuff. I like their content. Pretty nice. I've never used Simple Nursing except for their YouTube channel. Remar, she has, it was the quick, I think it was the quick facts, but at one point hers came with a DVD and I used that and I wasn't a big fan of it. And also, if I remember, she uses like when you're doing questions and answers and you're going through stuff, you have to get the question right or it won't let you progress. So at that point, if you don't get it wrong, if you don't get it right, you're going to progress and you're going to be like, all right, cool. Well, now I know what this answer is. So then to me, it becomes a memorization rather than it just like letting you get it wrong and then you go back and read the rationales. I'm not sure. That's how it was when I took it, but I'm not sure how it is now. I'm about to start my LPN program. I review with Nurse Chung. I don't know who Nurse Chung is. I personally don't know who that individual is. So, but shout out to Nurse Chung. Shout out to whoever that is. All right, well, we got bees everywhere. All right, throw some bees on it. Here we go. All right, well, of course, the answer is B. HIV directly affects CD4T. HIV is a retrovirus that attacks the CD4T lymphocytes, eventually leading to the death of those cells and severe immunodeficiency of the individual who has acquired the infection. Once the CD4 count becomes too low, how low is too low? Host immune defenses cannot fend off opportunistic infections and malignancies. How low is too low? I already know y'all saw the answer. Y'all better put it on there. How low is too low? Shout out to all 83 of y'all rocking with me up in here. We got 14,000 likes, 200. So what happens if it's at 199? What is it then? If it's at 199? What do you have then if you're at 199? AIDS. That's right. You got AIDS. You got the AIDS, right? So I may have seen, I'm not even allowed to say may, but I have seen a few questions, at least for me on my exam, that popped, at least like one or two that involved not specifically HIV, but they were talking about the count. Like they were talking about the lab count. Like you have a patient that presented to your emergency room with blah, 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 blah. And then they threw out the lab values, right? My med search teacher, would off me if I got that wrong. Look. Hey, your secret's safe with me. I'm just saying, I got you. Which of the following statements is true about monotherapy for treatment of HIV disease? It is the only FDA approved treatment for HIV. It is acceptable. It is able to effectively destroy all viral particles of HIV. It interferes with the replication of HIV without causing any side effects. It appears to cause rapid resistance. Got C? Question mark? C? Question mark? Shout out to all 75 of y'all. What we thinking? Sorry if you guys hear my son in there. He's acting a fool. Just letting you know. He's acting a fool. Acting a fool. Let's see. You got C's. 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 Is your program available to use now in time to retake the NCLEX? So, Jimmy, my program right now, I only have content that's up, but right now that's in production is my new generation NCLEX or the next generation NCLEX PowerPoints with questions on how to break them down. So essentially, it's like an NCLEX class, as well as the production of the actual NCLEX review. So it depends on you. If you want to get it, but probably if you're going to take your NCLEX within the next month, I would honestly tell you no, because it may not work. It may not be available. It may not be available for you, but for the time they're trying to take it. Now, if somebody's trying to take it in December, you're going to be good to go. Do you think age 50 is too old to go to nursing school? Karen, really? You must be new here. Somebody let her know my thoughts on somebody that tells me how old they are when they go when they go to nursing school. I'm thinking of changing my answer, and I know that's not right. Don't you change that answer. Don't you change it. It does cause side effects. She knew. Yeah, she knew. No idea. That's okay. Age is just a number. That's it. Your age does not matter, Karen. Like, I got a nursing degree and I got a nursing license. I'm telling you right now that none of those, your age, your family, your kids, your husband, whoever, they are not on that exam. They are not on the exam when you take it. They're not on your degree when you get it. They're not on your license when you obtain it. So go to school. I had ladies I was in school with that were LPNs for 20 years that were in their late 40s, early 50s that were going back for their RN. So it all just depends on you and what you want to do for yourself. Did you know you were assuming the role of therapist when we have all these questions wrong? Yeah, I understand that. Remember, I already told you I've been an instructor, an educator for 8 years, so I already expect your questions. I already expect all of them. And trust me, I already expect to tell you I don't know, because I don't know everything. And just by the way, when you become a nurse, you're going to be a therapist too. All right. Believe it. If you aren't already a nurse, it appears to cause rapid resistance. It is D. The answer is D. I have people who are 50, depending on who you're on. What? Depending on how you're aging. Rose, what are you talking about? Rose? Sam got the party hat. Shout out to you, Sam. All right, so we already talked a lot about the antiretroviral drugs and all that good stuff. So Jacob said, I take the NCLEX next spring. Any tips? Buy my course. No, but seriously, buy my course. But I tell you right now is, one, you want to get a good review, which is why I say buy my course. See, I told you, Sandy, not to change your answer. Look at you. You want to recreate the testing center. You want to audit your time, and I mean literally audit your time, like on an Excel spreadsheet. You also want to put a study plan together for yourself. You want to also cancel out anybody that is noise. You want to cancel out anybody that is noise. So if you got people that are in your ear telling you like, oh my God, you don't want to hang out with me. Oh my God, get rid of them. Get rid of them, because you're on this journey for yourself, for you to take care of yourself as well as take care of others. You see what I'm saying? So don't be listening to all the nonsense. Recreate the testing center. No drinks, no snacks. I got some Cheez-Its right here, and I'm about to eat the fuck out of them. Like, look at this, bro. Like, look, Cheez-Its, the originals. You see what I'm saying? Anyways, but no snacks, no drinks. I can have snacks and drinks because I'm the instructor and I can do that. So, those would be my suggestions to you. Just passing NCLEX. Shout out to you, Macy, for passing NCLEX in February. Sam, I'm going to tell you the same thing. Thank you, guys. You're welcome. What resources do you suggest for someone who graduated but has had to be out of the field for 3 years? What do you mean? Like for NCLEX, you mean? I'm taking my PN next month. Shout out to you, Archer and Mark Clemick. I use Kaplan and Mark Clemick. Loved it. ATI, terrible. But that's just me though. That's my, I don't like ATI and I don't like Hesse. Like I don't. I actually like Kaplan, believe it or not. So if Kaplan would have been in my school, I probably would have done better. But then again, it all just depends. Not the original. ATI is terrible. I agree. All right, here we go. Oh, well, look like we're at a break. Hey, so every 5 questions this happens. Sorry, I mean, that's all I got for you. But anyways, hey, so if you're new here, thank you. I appreciate you being here. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go and follow me on YouTube, Instagram, Thread, X, OnlyFans. I'm just playing. I don't have an OnlyFans. Or do I? Anyways, hey, we're doing pharmacology NCLEX questions right now. All right. And the one thing I want you guys to do is to participate. If I can't get to your questions, somebody in the chat will get to your questions. Right? He deleted them. Hey, don't do that. Make sure you guys participate. All right. I'm kind of, sort of, not really, but kind of, sort of, maybe a little bit funny. All right. I try to, we try to bring good energy up in here. You know what I'm saying? Hey, the more that you like, the more that you get. I'm just saying, the more that you like, the more that you get. All right. Right now, we're only doing 20 questions. I know you guys want me to do more, but this is a continuation from Monday. Okay. So give me 20,000 likes. Let's make it happen. I need 10,000 people to follow me. I need all of y'all to follow me. One, because I'm really, really funny. I'm like a comedian, but not really. But I need 10,000 people to follow me so I can, stream on the computer and, not stream from the phone and be ghetto. Because that's what somebody told me. Somebody told me I was ghetto for streaming off the phone. And I'm like, bro, I can't help that. But yes, my course. I will always talk about my course every time we come to I'm him. I'm trying to be him as much as I possibly can. But I always talk about my course, the 7-day NCLEX course. Yes, it's exactly what you think it is. It is an NCLEX course that I have created, but it is in its pre-launch phase, which means that we're still building it. We're building the Spirit airline so we can get to Air Emirates. Y'all, you see what I'm saying? Y'all trying to pay $10,000 to fly first class for 15 hours, baby? That's what I'm talking about. So, yeah, that link is in my link tree in the bio. If you get it forever for $48, which is 80% off of what its current value is, right? And as of right now, before I even got on here, I recorded 3 content videos, and they were all for fluid, acid-base imbalances, where we were talking about, ABGs and all that good stuff. I'm just letting y'all know. What's up. Hey, and like I said, if you're a nursing student and you just started school this week or next week or whatever, or if you don't graduate for another 6 months to a year, or if you're LPN going into the RN program, for you to get an NCLEX review for $48, hey, that's a lot. That's a lot. I'm just saying. So, like I said, go check it out. Tell a friend to tell a friend, phone a friend, whatever, and go check that out. I'm just letting y'all know it's in the pre-launch phase, so don't be coming at me sideways saying, oh my God, it's not done. I done already told you. We building the plane, baby, as we're flying or falling. We're going to Air Emirates. That's what we doing, okay? Also, don't troll my chat. You act up in my chat, you're getting a 600. A 600 just means 600 seconds, which equals 10 minutes, and that's how long I'm going to ban you. But I'm just going to ban you forever. Also, I don't gatekeep. I got these questions from nurseslab.com. These are pretty good questions, in my opinion, and at least they get you prepared. These aren't necessarily NGN questions. However, let me explain something to you guys first, okay? The new generation NCLEX style of questions, all it is the question format that's different. The content has not changed. The whole point is to develop your critical thinking and your clinical judgment skills. That is what it is about. Okay. I need everybody to hear me when I say that. So when people are just like, oh, these are just multiple choice questions and select all that apply. Baby, what you think this is? You still getting them questions. You see what I'm saying? You still getting select all that apply, but now you're going to get case studies with highlights and drop downs and all that other good stuff. And you get partial credit. Hindsight's 2020. I wish I would have had this type of exam. And then I probably wouldn't have failed that motherfucker like 3 times. You see what I'm saying? However, those failures or being unsuccessful is what makes you a better person and what makes you a better nurse. Trust me when I tell you that. All right. So nurselab.com, especially if you're a nursing student and you want to look up NANDAs, like nursing diagnosis, fantastic. All right. Let me see what y'all are talking about while y'all read this. Question 41. I think we already did this one. How would you approach studying for NCLEX, for example? Study the subject, OB, pharm, etc. Pocahontas, one thing I tell you is start with the subjects that are hard. And by the ones that are hard for you, like for me, it was pharmacology. So I studied and I put those lectures and stuff like that on a calendar. And I was like, all right, I'm gonna study cardiac meds. I'm gonna study antivirals, antifungals. I would study all of those. And then I would move on to the next subject. So if I needed to go to, cardiac, or if I needed to go to oncology or respiratory or endocrinology, I would start with the most difficult sections that I didn't know. And then I would work my way to the ones that I did know. And now I was most comfortable with. 4 months left, NCLEX in February. I'm scared. Sam, didn't we talk about this? We talked about this. It's going to be every subject you don't know. Yep. I have the Mark Klimic lectures, thankfully, but I'm more of a tactile learner. So here's the thing about the Mark Klimic lectures is that Mark Klimic, those lectures, although they haven't necessarily changed, his audios are very old, like from 2008, right? However, it's still 90% correct. All it is content and put it into a relevant format for you to understand it, okay? Learn how to take the test, recreate the testing center, right? Recreate the testing center. The only NCLEX program to study is Remar Review. This dude is lying. I don't know exactly what that means. Was it is it Mr. Intuition? It seems to me you probably don't have a lot. But there we go. I got you, DeWood. I already did it. I failed the old one twice and passed the new one. Hey, that's what I'm talking about. In a term for LVN school. Shout out to you. Hey, by the way, Remar is pretty good. I ain't lying. I didn't say that she was bad, right? But hey, haters gonna hate, right? We did answer. It's C. Just received my ATT number yesterday. I'm nervous to schedule my test. Hey Shay, just go schedule your test. It doesn't matter if it doesn't matter if you wait. It doesn't matter if you wait or if you do it now. You're still gonna feel the same. Regardless of what you do, the results will still be the same. So you might as well just pick it. You might as well just do it. I think we already did this one, and the answer was C. It was C. We already did this one. Yvonne, hi, how are you? You're late. Yes, you are. You are late, and that's okay. And we already did that one. And I think we did not do this one. There we go. Which of the following drugs might be given to relieve pain from a corneal abrasion? What do we got? What do we got? What do we got? What time do you do this live? 5:30. If you're feeling ready sooner, you can. Yep. And the thing about it is, like, if you just got out of school, everybody's saying A. So if you just got out of school, and you just got your ATT, I'd say take it, because that the longer you wait, the more like everything goes out. You know what I'm saying? Some of the questions I practice is not the content I study. It's just random. What do you mean? I hate farm. Sam, that's cool. That's cool if you hate farm. Deb says A. If you hate A, here's the thing. You can hate it, but you better learn it. You better learn it. I'm just letting you know. You better learn it. You just let you know. Shout out to all 70 of y'all that are in here rocking with me. Shout out to all 70 of y'all that are in here rocking with me. Make sure you guys share. Make sure you guys like. Hey, I need 20,000 likes, y'all. Get me there. Come on. Stop playing. Get me there. Come on. Come on. Come on. Hey, after we get to all these questions, we're going to do a little, we'll do a little Q&A, as I can sit here and watch me eat these Cheez-Its. Lena says A. Is it Prati? Prati says A. Jamin says A. Is it Fayetta? I messed that up, and I'm sorry. You say B. Okay. All right. Cool. All right. Let's see what the answer is. And the answer is, it is A. This is the only drug listed that is a anesthetic eye preparation, and it's Alkane. Alkane ophthalmic solution is indicated for topical anesthesia of ophthalmic practice. Representative ophthalmic procedures. Representative ophthalmic procedures in which the preparation provides good local anesthetic, including measurement of intraocular pressure, removal of foreign objects and sutures from the cornea, conjunctival scraping in diagnosing, and what is that? Gonioscope. I've never heard of that. Gonioscopic examination. It is also indicated for use as a topical anesthetic prior to surgical operations, such as a cataract extraction. So, shout out to y'all. Shout out to everybody that picked A. For the people that don't know me, I passed NCLEX on the 7th time, and Kevin was my coach. Yep, straight is. I still am. All right, how we feel about that? I think we're good. All right, so we'll go on to the next one. Shout out to all y'all. Keep smashing that like button. Keep sharing. You will never know who will need this. All right, drugs that have lower intraocular pressure work by increasing what? The flow of aqueous humor through the anterior chamber. Is it B, fluid volume in the eye's anterior chamber? Is it C, pressure in the eye chamber? Or is it D, diameter in the eye chamber? What we got? Let's see. What says D? Okay. It says D. A. If you don't know, that's okay. But I would rather you guess. Fabi says A. Okay. Got C. Because, hey, when you guys are practicing and you guess, what's going to happen to you? Let's change it. Let's think about this. Let's change up the mindset a little bit. So what's going to happen to you if you guess right here? Nothing. Nothing. Like nothing terrible is going to happen. All it is just a learning experience. Yeah, you'll improve your thought process. That's exactly what it is. So even if you don't know what the answer is, guess. And then go read the rationale. Honey says A. Okay. Lance says C. Alexa says A. Lexi Page says A. All right, cool. All right, cool. Hey, make sure you guys follow. I need 10,000 people so I can not be ghetto. All right, cool. Here we go. All right, and the answer is A, the flow of aqueous humor through the anterior chamber. Drugs that lower intraocular pressure increases the flow of aqueous humor through the eye's anterior chamber. The goal of glaucoma treatment is to improve quality of life through the reduction of IOP to preserve visual function. In the process of IOP reduction, an ideal medication should have a schedule that is simple to follow, but least interrupting with a patient's life, highly tolerable and affordable. Okay. Hey, I was getting scared when I was the only one who answered. Who cares? Don't worry about them. Hey, don't be. So here's the thing, Fabi, I'm going to tell you, don't get scared about what they got going on because ain't none of them taking the exam with you. I'm just saying, ain't none of them taking the exam with you. All right. Don't get scared. And if you're scared, go to church. I'm just saying. Or, whatever, structure the, religious, you know what I'm talking about. Shout out to y'all. Make sure I smash that like button, y'all, and y'all love and like me, please. And y'all share and y'all follow. I appreciate you. Shout out to all 55 of y'all. Let's check out the next question. Question number 45. When administering, that has to be like optic. I don't know why it's like that, but optic, preparations, the nurse should observe the tympanic membrane for what? Erythema, perforation, fluid, or all the above. Talk less. We need more questions. Nope. Talk less, ma'am. I think not. Do you not know who I am? I love to talk. That's why I became an instructor. It only makes sense. Everybody's saying D. Yeah, for sure. Hey, look. I'm just saying. And I was just reading the rationale. What are you talking about? You want me to not read the rationale? I have a bad habit of thinking the answer is always all the above. That's usually like one of those ones kind of stay away from it. Right? All right. Well, everybody's saying D. That looks like the general consensus, right? I think that's it. All right. Cool. Let's see what the answer is. Since I talk too much, let's see. The answer is all the above. All the above. E is not on there. What are you talking about? What do you mean, sir? What do you mean? The nurse should assess all of the following parameters when administering, is it otic? Either otic or optic. I'm going to say optic. Preparations. When a patient is seen in the clinic setting, the healthcare provider may be responsible for examining the outer structure of the ear as part of the intake procedure. Be sure to document a description of any drainage or visible wax before prescribing an optic preparation. The primary healthcare provider examines the ear's external and internal structure. All right. Oh, hey, like I said, remember, if you don't know it, that's okay. This is what this is for. Read why the answer's right and then understand why the answers are wrong, why you guys are studying, okay? Oh, look at that. Hey, remember, like I said, every five questions, something like this is going to pop up. So depending on how many likes I get and how many people love me and all the other stuff, I might just do them every 10. I don't know how I feel yet. But anyways, so if you're new here, welcome. My name is Kevin. I am a registered nurse. I've been a nurse for 3 years. I go by the Boot Nurse on all social media platforms. Make sure you guys check them out. If you know anybody that may miss this, tell them to go look at my YouTube channel. All the TikToks that I record will end up over there. So if you want to sit there for a couple of hours to look at them, and as we go through the questions, cool. It'll be like you were just here. All right. Participation is the key. I like to see everybody participate. I love seeing y'all up in here participating with one another. If I can't answer it, you guys, pick that up and you guys answer it for somebody else as well. And all of that is helpful. All right. And I'm kind of sort of, but not really, but kind of really funny. All right. So just let me be me. I am him, as somebody told me earlier. Right. Hey, so the more likes you get, or the more likes I get, or gifts or whatever, the more questions that you get. But whatever, you do you. I want 20,000 likes. Let's make it happen. 20,000 likes. Let's make it happen. I need 10,000 people to follow me so I can stream off the computer. Because that way, TikTok will let me be great. But I got to be ghetto right now because, of whatever reason. So, but yeah. 7-day NCLEX course. That is my course. It is exactly what it is. It's in its pre-launch. The link is in the link is in my link tree. Make sure you guys check that out. It's in its pre-launch right now. So if you get it right now, you get it for $48 and you get it forever. Just saying. Like I said, you get it forever. Right? We've got content going in there. New generation NCLEX content going in there, or should I say, new generation NCLEX content going in there. Reviews going to be going in there as well. So like I said, you can't beat that for $48. I'm just being all the way real. So make sure you guys go over there and check that out. Don't troll the chat. Don't come up in here telling me that something is better and blah, 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 blah. Everybody is different. It may not work for you and it may not work for them. So, come in here and act like you got some sense. If not, I'm going to ban that ass. I'm just saying. And everybody in the chat, hey, put it this way. I got 65 people up in here. If anybody comes in here and they started trolling, and if I don't see it, I leave it up to the democracy. I'm like, what do y'all think? 600? Just drop 600 in there. If you want me to ban myself, I'll 600 myself right now. All right. And also, I don't gatekeep. I don't gatekeep at all. I got these questions from nurseslab.com. They have different type of questions on there. You guys can go over there and check them out. I just thought that this was a really fun thing to bring to you guys and to bring, to essentially bring the light, bring the fire, bring my expertise and bring, what I have known for myself, what have worked and what has not worked for you. Okay. But what I want to know is who you are, where you're from, where you're at in your nursing journey. What questions do you have? Have you taken the NCLEX? Are you a pre-nursing student? Are you in nursing school right now? Let us know. Let us develop that dialogue down there in the chat. And let's go on to these last bit of questions. All right, here we go. Question 45. I'm just going to say her first name. Mara has been diagnosed with scabies. Ew. No, it's not. I think it is only free. They have other things in there as well. And it is free. I did say it was free. Didn't I not say it was free? Was it Kari? Is that Kari? Kari said, I'm in my last year of RN school. I'm a terrible test taker. I overthink everything. Any tips? The best way for you to get through being an overthinker and like all that anxiety is that you have to recreate the testing center. Like you have to get that repetition down. Once you get the repetition down, like when you go and you sit for an exam, it should be a no-brainer. Like I had test anxiety just like everybody else did. And then next thing you know, I go take my NCLEX. I'm at question 45 and didn't even realize it because I had already put myself through recreating the testing center, getting rid of all distractions, so on and so forth. And if it is really, really bad, I would look into, probably looking up, talking to somebody. Chrissy, I can't read that because it's small. I can't read that. Okay, so yeah, we said that scabies. His physician orders. Is it Crotamitten, whatever. After 1 week of treatment, the client reports that the paresis has not stopped, or paresis. There it is. Has not stopped. You would advise the client to what? Stop applying the medication, continue treatment, call the provider, or none of the above. Everybody's saying B. Is your questions different from the NGN questions? What do you mean? Like in what context? Like I'm not sure. Like, are you talking about these questions right here? Because these questions are from Nurses Lab nurseslabs.com. Okay. And like I said, the new generation NCLEX style questions are additions. They're additives. They're additions. They're additives. So you're still going to get select all that apply. You're still going to get multiple choice. You're still going to get, drag and drop. You're still going to get put them in this order. You're still going to get dosage calculations. You're still going to get those. Okay. You're still going to get those questions. Now, these questions right here, I haven't come across any new generation NCLEX style questions, right? So, but like I said, this right here, I've always tell people this will get the gears rolling, right, in your head when you're preparing for NCLEX. Okay, so we do know that there's case studies for the NCLEX, right? You can get, I think, anywhere from between 6 to 8 if I'm correct, if I remember looking at stuff, but you can get anywhere between 6 to 8 case studies or I'm sorry, you can get 6 to 8 questions out of one case study. Okay. So think about that. And the answer was B. Many times, what is it? Pruritus is not relieved for 46 weeks after the therapy has been initiated. Use this medication only as directed. Do not use it more often than the doctor orders. This medication usually comes with patient directions, and make sure that you follow them. So there's that. There's that answer. All right. Avery, what's up? How are you? Welcome to the stream. Welcome to the stream. We're on question 47. All right. Hey, by the way, I'm just letting you guys know we only did 20 questions today, and we started off a continuation from where we were on Monday. So that's where we are. I just got home from my mental health sim. Okay. Shout out to you. Shout out to you. What code? Do you have any simulation code greens? Because we both know how those go. Jake has psoriasis of the scalp. The physician has ordered, is it Z-Tar shampoo? You would advise the client to what? Avoid sun exposure to the scalp. Use the shampoo PRN. Report pruritus or none of the above. A? Question mark? A? Sandy says A. Sandy says A. A. Alexa says A. Gabby says A. Okay. Ray says A. Okay, well, it looks like A is the general consensus of the answers, right? So, so Mark says B. Okay. Mark says B. All right. Shout out to you, Mark. Shout out to you, Mark, for the answer B. Actually, it might be B. Look, hey, Avery, it might be. It might be. Tiffany says B. Look, see, this is why I give y'all time to answer this. Because some people are just like, just give me the answer already, Kevin. I'm just like, look, but other people are answering. So everybody should be heard. Yeah. You know what I'm saying? Yeah, B. Okay. B, I'm changing. All right. Hey, y'all know how I feel about y'all changing answers, right? But y'all also know how I feel about reading the question. Who remembers what RTFQ means? I remember learning about sunlight and psoriasis. I don't remember. I just don't remember exactly what. You can't overdo it. I said read the questions. RTFQ. You want to read the RTFQ. Read the explicit word banned by TikTok question. Right. That's what I say every time. Read the question all the way through. And if you can't definitively tell me why you're changing your answer, you better not change your answer. All right. Right. Prescribed shampoo. It's not asking about the diagnosis of pertussis. Okay. Or I'm sorry, pertussis. Oh my God. Of psoriasis. All right, cool. Nurse Chung does a review for ATI and T's exam. Shout out to her. And the answer is A, avoid sunlight, avoid sun exposure to the scalp. So shout out to everybody who got that right. One of the side effects of Z-Tar shampoo is photosensitivity, right? This medication makes a person more sensitive to the sun. Be sure to completely wash off the medication before going out into the sun. Avoid sun exposure, tanning booths, and sun lamps for at least 24 hours after using this medication, unless the doctor directs otherwise. Other medications may also increase sun sensitivity. Says, yes. Tiffany, it's okay. Now you know why, right? It says, LOL, now I'm embarrassed, but I'm glad I know why. That's what I'm saying. That's what I'm saying. Don't be embarrassed. Don't be embarrassed. Ain't nobody gonna sit here and like, girl, you dumb. Ain't nobody say that. Ain't nobody saying that. Don't change your answers. That's right. Stick with it. Stick with it. Shout out to all 90 of y'all that are out here hanging. Got 29 shares. Yo, keep sharing it, y'all. Keep sharing it. We do this all the time, all right? Make sure you guys smash that like button. I want 20,000 likes. 20,000 likes. Pick it and stick it. I messed up by changing. Yes, you got to stay with it. You got to stay with it, all right? All right, question 48. Atopical. Topical antibiotics work by how? Inhibiting replication of a virus, blocking histamine 1 and 2 receptors, binding to fungal cell membranes, or inhibiting bacterial cell wall synthesis. Avery says D. Avery says D. All right. We say D. All right. So here's a question while everybody is answering. I'm in LPN school right now. This man is saving my life. Shout out to you. Key, I got you. That's what I'm here for. That's what I'm here for. Like I said, I do these 3 times a week. I thought about not doing them today, but then somebody was just like, can we do them today? And I was just like, sure, why not? And so I just like, let me just give you these last 2. So I'm glad that this is working for you, Key. I really am. All right. So everybody's saying D. Everybody's saying D. All right. So let me ask you guys this question. Would you consider this question a passing level question if you were taking your NCLEX exam? Would you consider this a passing level question? DeWood says no. Tell me why. Tell me your answer. What does that mean? What does what mean, Avery? Oh, NCLEX passing level question. Okay. So there are essentially four levels to NCLEX style questions, right? So easy questions are ones like, hey, I know the definition, or hey, it's memorization, right? But the questions that the NCLEX wants you to answer are the ones that involve critical thinking and clinical judgment, such as analysis questions, right? So as in, you're the nurse working on a floor, taking care of 4 patients. Which patient would you see first? That's a management of care question, right? So you need to know based off of whatever the answers are, who you see first. Who's going to die before I see them, right? None of the others are referring to bacteria. Okay. So you said D, I think. Yeah, you did say D. Okay. Juliet said D as well. So yeah, you want the level of NCLEX style questions. That's what you want. Like the passing level questions are the ones that are like analyzing and application, right? Memorization and remembering are not passing level questions, right? Definition type of questions are not NCLEX. They're not passing level questions. Okay. So if I said, hey, what's cranial nerve? Or if I said cranial nerve number 5 works by what? Or I'm sorry, cranial nerve number 5 is what? And then it gives you the definition. That's not a passing level question. Right? But if I gave you an answer out here where it says, you're the nurse taking care of a patient who has myasthenia gravis, right? Upon examination, you notice that the patient has difficulty swallowing, has muscular atrophy to the lower extremities, and yada, yada, yada. Which cranial nerve does that affect? Does that make sense? Okay. Like, okay, we'll go to the answer because I know y'all are looking for that. So let me see what y'all are saying. Like for this question, you have to make the connection of antibiotics equal bacteria. Not correct. Correct. But then you got to critically think even further than that, Avery. But you'll understand that more as you go through school. No, because I think this is a memorization question. There is no critical thinking needed. You're correct, Tiffany, 100%, right? Because this is a question that you would get in school, right? I would ask you this question on a test or on a quiz. Remember, these aren't my questions, right? These are questions that get the mind going, get those gears churning, right? All right, but the answer was D, inhibit bacterial cell wall synthesis. Topical antibiotics work by inhibiting bacterial cell wall synthesis. The pharmacology behind antibiotics includes destroying the bacterial cell by either preventing cell reproduction or changing a necessary cellular function or process within the wall. Okay? How y'all feel about that? I think that looks good. How we feel about that? It's looking good. All right, we'll go to the next question. All right, so shout out to y'all. Shout out to all 74 of y'all up in here. Hey, if you're new here, welcome. We're doing pharmacology questions. My name is Kevin. I go by the Boot Nurse. Let us know who you are, where you're from, where you're at in your nursing journey, so on and so forth. Does these questions work for LPN as well? Yes, they do. Yes, they do. So the biggest thing that you need to know in regards to LPN, the difference between LPN or LVN, depending on where you are, or RN, is you need to know what you can and can't do. And you need to know what you can and can't accept as an LPN. Like LPNs can't take unstable patients. LPNs cannot do blood transfusions. Although you need to know about blood, you can't do them. LVNs can't do IVs. You can't push IV medications. You can't do central lines. You can't do PICC lines, right? If you have a patient that's stable and then they become unstable, they are no longer your patient, according to the National Council of State Boards of Nursing. Okay. So those are the things that you have to think about when you're taking your exam, right? What would we say? Scabies, fungal infection, viral infection, or head lice. Everybody's saying D. Anybody in here ever had head lice? Not me. Because, yeah. Anyways, I'm just playing. Kevin, are the Lions beating the Chiefs tomorrow? I don't even know, to be honest. To be honest, I ain't even gonna lie to you. I ain't even been watching the NFL. Like, I've never been so excited about college football because Deion Sanders is the coach for Colorado, and that's all I'm really paying attention to. I ain't even gonna lie to you. PD is feet in Latin. Yeah, it is. Like for pedicure, or yeah, pedicure, pedi, blah 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 blah. But a lot of people are saying D, element. Yes, elementary school. I got you. Why you laughing, Dawood? What I do? What I do? I think I know why you laughing. Christy says D. But I don't know. Let's see if the Lions do beat the Chiefs. We'll see if they do beat the Chiefs. All right. So I think everybody, I got a pretty couple of answers that are out there. So is it T? T. I'm just gonna call you T. T says B. It could be B, to be honest. It could be B, right? Abby says B with a question mark. Shannon says B. Is it Desi? Desi says B. I heard PD. I think feet. First of all, when you hear PD, it's not about like, girl, I'm about to go get my feet done. Like, it could be that, but that's a good way to think about it, right? Hey, even if you get this question wrong, that's okay. This is a safe space for you to get it wrong. When you're studying it, it's a safe space for you to get it wrong, right? I'm thinking athlete's feet. Okay. I like where your head's at. Okay. We got D. All right. Let's see what the answer is. The answer is D. For head lice. D for head lice. RIP. Where you going? Hey, but that's okay. That is okay. That is okay. Don't cry. Don't cry. Hey, don't cry. It's okay. Don't cry. Hey, look, because, it happens. But this is a safe space. This is a safe space for you to get these questions wrong so you know why. Okay? But yeah, this what is it? The PD is the pediculicide or culicides, whatever, are effective treatments for head lice. I don't know. I've never had head lice because, yeah. But anyways, this is the answer. It's an anti-parasitic medication that treats head lice and all these other words that I am not even going to attempt to say. Not even going to attempt. Hey, give me the 20,000 likes. Make it happen. Hey, I'm at 31 shares. Make it happen. Okay? Make it happen. Make it happen. All right? Here we go. Next one. All right. Here we go. Question number 50. Shout out to all 87 of y'all that are in here rocking with me. Alice is using antiviral creams for her genital herpes. Which of the following is a potential side effect of this medication? Is it vulvitis, headache, dizziness, or staining of the skin? Leah says A. Leah quick with it. She's like, A. Tiffany says A. Okay. Avery says D. Way to be different, Avery. Way to be different. User 45 says A. Is it Biviana? Is it Biviana? Man, y'all got some unique ass names. Biviana says A. Abby says, I like this for practice. I'm starting prereqs to get my ADN soon. Shout out to you, Abs. Start calling you Abs. Alexis. Lexi says A. We got D. Doris says A. Marie says B. Leah says, I'm guessing here, but it makes sense as a topical. Okay. I feel like it would help with, but it is. Okay. A. Vulvitis. You can full out. I'm just going to say rule out. You can rule out A, B since they're very similar answers. Kinda. Where is E for all the above? Not on this question, Courtney, girl. What you think this is? I started a nurses program October 4th, and I'm excited and nervous. Hey, be excited, but be prepared. Be prepared for your whole life to change. Mayra says A or D. Mayra, I'm going to need for you to pick one. Okay, got vulva. Got a lot of people saying A. A lot of people who can't determine. Chrissy says D. Okay. Is it Lily? She says A. I'm taking my NCLEX December 27th. That's what I'm talking about, Savannah. What I'm talking about. You're guessing D? Okay. I don't think A and B are similar. That's cool. That's cool. Change is a good change. Look, ma'am. Is it Shayna? Look, I'm just let you know. You about to embark on a journey. Oh, y'all let her know how nursing school is. It is a journey, let me tell you. All right. So, man, y'all got me to 20,000 likes. Hey, shout out to y'all. I start my program in January. I'm so excited and ready. That's what I'm talking about. Be ready for it. Be ready. Be ready. Be ready to push your way through it. It's fun. Sandy, you're funny. A nursing school is not for the weak. I'm telling you right now, you'll get humbled real quick. You will get humbled real quick. We got some A's. A lot of people said A. We got some D's on there. Throw some D's on it. I love it. It's a lot of fun. You learn a lot. Leah, I don't know who you lying to, but let me tell. Okay, that you said it is intense. Okay, all right, cool. You said that. I appreciate you. Nursing school is rough. I'm dying. Hey, you ain't dying. You alive. And if you dying, I need for you to go seek emergency services. Okay. I still have PTSD. Look, we all do, right? Let me tell you. Wait until you hear a code blue for the first time, and that code blue tone is going to haunt you for the rest of your life. I'm just saying. I'm always crying. Oh my God. All right, here we go, y'all. We about to answer this question. Y'all ready? Here we go. In 3, 2. Listen, did you guys know that lady that does combat gel is getting a divorce from her husband? Now you do. Oh my God. I'm terrible. Here we go. And the answer is A. The answer is A. I'm so mad about that. She's so sweet. Hey, look, hey, don't be trying to jump into other people's business. We don't know what's going on with them, okay? I'm just saying, I graduated nursing school as a single mom of 2. If I can do it, you can do it. Hey, look, I was active duty in the Navy when I got through nursing school, all of it. If I can do it, if this young lady, who said that, Savannah can get through as a single mom with 2 chillins, you can do it too. Code blues are for adrenaline junkies. Look, let me tell you something right now. I've heard my fair share of code blues, and I'm telling you right now, they will always, like, I'm telling you, trigger. They will trigger you. They will trigger you badly. All right. All right. So antiviral creams can cause vulvitis when applied to the genitalia to treat genital herpes. A cyclovir cream is used to treat cold sores on the face or lips. A cyclovir ointment is used to treat first outbreaks of genital herpes and to treat certain types of sores caused by the herpes simplex virus in people with weak immune systems. Angie, same thing. Good luck. I'm a mom of 4 on top of my classes. Shout out to you. Just fight through it. Hey, you guys are hearing me say a term, get off this beach. I wonder if anybody in here knows what that means. Get out of here. If anybody knows what that means, the term get off this beach. All right. So, hey, when you start nursing school, it's going to hit you. It's going to hit you hard. No code blues in hospice. Oh, ma'am, really? You really had to do that? Yeah. Yeah, I like how you don't got no smiley face on there, no code blues. I cannot with you. But when you start nursing school, or anybody that's in school right now, or even if you prepare for your NCLEX, or even if you failed your NCLEX, you got to get off that beach, right? And if anybody knows what that term means, then cool, right? But I'm telling you right now, you got to push. All right. Hey, so we're done. We only did 20 questions tonight. I'm sorry. I know that you guys wanted more, but I promise you, I will give you guys more. You guys want questions? I got you. I promise. Is it worth it to just get your ADN instead of your BSN? Abby, you go for what you feel like you need to do for yourself. If you need to go get your ADN first and then go online and get your BSN, do that. That saves you a ton of money and it saves you, time. And I know people that go and be an LVN or an LPN and then they bridge and they do that. You could do that as well. So it all just depends on what you need to do for yourself and how you are financially. I hear people come in here say, hey, don't do LPN, don't do ADN, go straight to BSN. Okay, thank you for being inside my pocket because what the fuck I got going on. You know what I'm saying? So do what you feel is best for you. Me, hindsight's 2020. If I could have went back and done it all over again, I would have done an ADN program and then I would have taken my BSN classes online because that way I would have been working and taking one class at a time and I wouldn't have been so stressed out. But that was me. Hindsight's 2020. That may be different for you. So it all depends on what you want to do for yourself. How did you guys figure out your specialty and what unit you wanted to work on? I worked in the ICU for a year during COVID and I left. I wanted to do CRNA. I wanted to do a whole bunch of other stuff. It just didn't work out for me like that. All right. So I work in the operating room now. I've been a nurse for 3.5 years. I've been an instructor for 8 years. So yeah. There's that. Dang, I just got here too late. It's okay, Leah, because any of these TikToks that I do, they end up on YouTube and you can go check them out over there. Don't gatekeep. What's the beach? Tiffany, I'll tell you here in a second. I'm trying to catch up on these questions. What was the word? I was the worst student, high school dropout. Did GED, graduated with social degree in nursing? It can be done. And you know what's crazy? No one will ever ask you that, Gabby, ever, unless you openly want to tell them that. And so by opening up and telling us that right now, that just gives you. What that does, it gives other people perspective about their life and where they are and so how they can accomplish things. So I'm doing the bridge. Shout out to you, Karen. NCLEX was hard as fuck. Everyone bless y'all. Look, Chloe, it is hard. It ain't meant to be easy. If it was meant to be easy, whatever fucking clown that you were in high school with will be a nurse with you. Think about it. You want that fool to be a nurse? Probably not, right? Savannah said, I did my associates and bachelor's together, have 2 classes left until I get my bachelor's. Shout out to you, Savannah. I'm in PACU. Look, let me tell you about PACU. PACU is the holy fucking grail, and I love it. How often do you do NCLEX review questions? Mills, I do them every Monday, Wednesday, and Friday. When's your next, what are you doing your next session? I don't know. Somebody said fundamentals. I think it was AJ who asked me for fundamentals. And I was like, all right, cool. We can do probably fundamentals. I work in a hospital, just started LPN RN Bridge. Okay. Y'all got this. My first time here and I'm so motivated. Look, all I do is bring the motivation. So shout out to all of y'all. Hey, so thank y'all for participating. I appreciate any of the likes and the gifts that you guys gave me. Like, you guys really don't understand how much like this means the world to me. And I'll tell you about PACU here in a second, Abby, or anybody else can tell you about it as well. It really does mean the world to me that y'all come through because I do this for y'all. I wish when I was in school that I even had the thought process to get on social media to find something like this, but you didn't really find a bunch of people doing it, you know? And then, you know, I had my notions about TikTok especially, but now I use it for this reason and this reason only, so I can get out here and talk to y'all and, you know, be like, hey, yo, what up? You know what I'm saying? Because who knows? I might run into one of y'all if I do traveling or if I do anything like that. So, I always talk about my 7-day NCLEX course. That link is in my link tree in my bio. It's for $48. It's 80% off its current price. Once you get it, you have it forever. So if you're just now starting your nursing program, go check it out. It's in its pre-launch phase right now. So we're building it. We're building this Spirit airline so we can be Air Emirates, baby. That's what we're doing. That's what I'm about. You feel me? So make sure you guys go over there and check that out. Hey, and like I said, once you get it forever. You see what I'm saying? And I'm here every Monday, Wednesday, and Friday. So it's not like you don't know where I'm at. You know what I mean? So I'm here and we're building it. We're building it together. All right. I gave one person a 600 today because he decided to come up here and act a fool. So there's that. And once again, I don't gatekeep. I got these questions from nurselabs.com. You guys can go over there and check them out for yourself. Also, I don't get sponsored by them. I found them. They were free. Why not go and looking for something free to get the gears turning? All right. To get the gears turning. All right. Also, if you're a new nursing student and you want to learn, they have like nursing diagnosis, NANDAs, and all that good stuff over there. Super duper helpful. I used this a lot when I was in nursing school, and that was 5 years ago, and it feels like forever. So you can go over there and check that out as well. So what I'm about to do is turn this camera around so y'all can see in my hideous face. All right. And so now what we're gonna do is somebody asked me about gatekeeping. Hey, how y'all doing? I'm Kevin. I got a boot nurse shirt. It's mine, whatever. But I appreciate y'all being here. Did you say, who's Jason? I'm not Jason. Oh, you called me Jason Derulo? No, you did not. Don't do that. And first of all, he looks like me. Okay. Hey, how you? But welcome. Of course, you guys are here. We're going to be sitting here going back and forth. We'll talk about some stuff. But somebody said, don't gatekeep. Stop. Why do I see it? Because everybody says that to me. Like, everybody says I look like Jason Derulo, but in reality, he looks like me because I'm older than him. So there's that. Somebody asked me what is get off the beach. So it's a famous military quote that happened during Normandy when they were, storming the beaches of Normandy during World War II. And they said there was two things. Either there are two men that end up on the beach, a dead man and a man that's going to die. So the only way for you to live is to push forward, right? So if you're scared, when you're at when you start nursing school, if you're scared, you're going to end there. You're going to end there, and nursing school is going to destroy you, right? But you have to grab that fortitude. You can't say I've been wanting to be a nurse for so long, and then you get there to do it, and then you just fall off. You just fall out. Trust me, whatever y'all are about to go through, every single nurse in here has gone through. Everybody that's about to be a nurse or embark on that nursing journey. I 100% guarantee you're not going to go through nursing school and come and tell me, Kevin, you have no idea what I've been through. I'm like, excuse me? So every nurse in here is going to understand what it's like to have gone through nursing school. No, I live in Texas. So when I say get off the beach, that means wipe all that sand and dust off your face, and that ass better get up and move in the right direction. Okay? You need to get up and you need to move. Essentially, you need to move out of danger, and essentially consider nursing school danger. consider NCLEX like Berlin, like where the war is over, right? But then you got the rebuilding stage, which is after the NCLEX, because then you become a nurse and you got to get out here and work on these floors. Okay, so when I tell y'all to get off the beach, y'all will hear me say it. I'm just gonna kind of say it now. I can't say that it's mine because it's quoted from somebody else, but you're gonna hear me say it. Anytime I fail my NCLEX and I'm scared, get that ass off the beach. And the only thing that better come out of your mouth is, "You're right. I need to restudy for this. I need to do this." People don't realize anything new in life change is scary, especially experience. Facts. Same, Tiffany. It's okay, girl. Let's get off. That's right. Get off that beach. That's right. Get off the beach. Shout out to all 70 of y'all that are hanging out in here with me. I want to know who you are, where you're from, where you're at in your nursing journey. Are you taking NCLEX? What questions do you guys have? That's what I'm here for. I went through questions. Usually, I'm still doing questions, but I'm here for y'all. And so I was like, you know what, let me take this opportunity and sit here and talk to y'all and see what y'all want, see what questions you guys have. I'll answer them to the best of my abilities. There are people that are in here that I have personally coached, like Manasa. Manasa has failed her exam 6 times and she wears it like a WWF championship belt. I failed it 3 times. 3. And I passed on the 4th. But none of y'all would have ever known that, ever, unless I openly said that to y'all. You know what I'm saying? Somebody had to come and tell me. Somebody had to come and tell me, "Hey, what are you doing? Get up. Get up." What makes you think that all of a sudden you can accomplish something that hundreds and thousands of other people have accomplished? You see what I'm saying? So, with that being said, as somebody who was unsuccessful in my NCLEX multiple times and who has coached individuals who have failed their NCLEX multiple times, I'm telling you, get that ass up. Get up. Get up and stop playing with me. And I'm telling you, anybody that knows me as I coach, the exact same way that I'm talking to you now, it's the exact same way I talk to them. Like, I don't coddle. I don't do any of that. That's right. Tiffany, girl, let me tell you, you done found it. This is it. This right here. This is it. Ariel said, "I'm studying right now, listening to you, Central Texas. Last semester, ADN, gonna be at a cardiac PCU in January." Shout out to you. Is it Ariel or Ariel? Thanks for what you do. Antoinette, I appreciate that. I better pass my NCLEX the first time because I will stress until I do. Well, guess what? You will stress. So that ass better pass it. And also, there's another thing I want to say to y'all. Let's just say you don't pass it. You're going to sit here and you're going to try to blame everyone, everything. The review was trash. The instructor was trash. Blah, 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 blah. You're going to do all that. But I'm going to tell you right now, in the end of all that, everything is your fault. 3rd week of nursing school, perfect alignment. That's what I'm talking about. I have my prerequisites. What do I study? I answer that question. So everything is your fault. And you're probably asking why. How is everything my fault? Well, it is. It just is. You chose it. You did that. You decided not to study. You decided not to do any. You decided to not change things for yourself. Everything is your fault. But with that being said, how are you going to fix it? You see what I'm saying? How are you going to fix it? Okay. So think about that. I like to try to give you those little tidbits that you can. It's really thought provoking. Okay. I have my prerequisites. What do I study? What do you mean? Like your prerequisites? So like anatomy and physiology is huge. Pharmacology is big. Pathophysiology, those are big ones. Ada from Nigeria. That's my sister's name. Trying to see for my NCLEX. Really scared. Don't be scared. Don't be scared. If you're scared, go to church. All it is just an exam. What's the worst thing that can happen to you by you taking that exam? You know what I'm saying? Think about that. What's new on the NCLEX? I've heard some say it's easier to pass and some say it's harder. So it all just depends on you and how you study. It all just depends on you and how you study. The things that are new on the NCLEX, it's not the content. The content's the same. It's the delivery of how the content's given to you. So they give you, multiple response questions. You get case studies that they can give you anywhere from 6 to 8 questions out of. They have close statements. They have fill in the blank, which have drop downs. I want to say, I gotta remember, I think there's like 5 or 6. I did a whole lecture on it. And it's in my course right now. So if anybody that has my course, I know that they've seen it. So any tips for first semester? I'm in Texas and I'm getting my ADN. For your first semester is you need to get into a study group. Get into a small study group. I promise I'm going to get to all y'all's questions. And if I don't answer them, I'm pretty sure Monica can jump up in there. But get into a small study group with you and 3 other people. Okay. And what that'll do, that'll foster the team building environment, as well as you guys can share notes. 25%. Everybody does 25%. And if my math is mathing, that's 100%. Start a Google Docs. You do one section. Somebody else does one section. Y'all put y'all's notes together. Boom. Study together. Right? That's how you want to do it. I wish it didn't take me until my second semester to get that, or else I probably would have done better in fundamentals, right? Ariel like the mermaid. Okay. Okay. I was literally about to sing the Aladdin song, but I'd already know, obviously that ain't it. But okay. Shout out to the Little Mermaid, you know what I'm saying? Also find your support group in school, your classmates. They will push you to finish. Facts. And find you a good group. Don't find you a group of people. Listen, nursing is 89% women. There are mostly women that are in here, and I'm mostly talking to y'all. Find people that you vibe with. Don't do that mean girl shit. I promise you. Don't do that mean girl shit. That's a great movie, by the way. No, don't do the mean girl shit. Don't do it. Do not do it. And do not let that shit carry over to when you become a nurse. Because like that's a toxic thing that needs to fucking stop like at the beginning, right? Don't be the mean girls. Help each other out. You know what I'm saying? For those of us who have failed, can you explain the steps to start over? What do you mean, Sandy? I need a little bit more context. I didn't hear the answer, Kevin. What'd you ask, Karen? I'm sorry. I'm like 12 questions deep. Okay, I see it. Tiffany, okay, she's answering. I'm sorry. How did you study for pharm? Like, how did you break it down? Okay. So the way that I study for pharm is I studied, because I was using Kaplan at this point. So I literally went from each section of what the need to know things for pharmacology that you need to know for the NCLEX. So I started with the cardiac meds, and then I went to like antibiotics. Then I went to antivirals and antifungals, like the common ones that you will see. With pharmacology, it's all about family name and suffixes. So if I want to go to cardiac, all right, cool. So now that if I see pantoprazole, or if I see labetalol, all right, cool. I already know I'm going straight to the end. It's like my eyes are going straight to the end. So labetalol. LOL. Okay, so I know it's an LOL, so it's a beta blocker. A beta blocker is a cardiac med. Cool. Now, what does this cardiac med do? What is its purpose? It is to lower my blood pressure, right? What's another? Okay, so it lowers my blood pressure. So what am I thinking? What else is it going to do? Is it going to, what am I looking at? I'm looking for safety, orthostatic hypotension, syncope episodes. What else am I looking at? What is my potassium going to look like? Right? Now at this point, if my potassium is gone or if it's depleting, right? What is my EKG going to look like? That is when it comes to medications and answering questions, that's the process that you have to move. Like you have to critically think in steps and with trends. So if I do this, what is the expected outcome? Okay, if it's not expected, what do I do if it's unexpected? Right? That's how you break it down. Man, was on the receiving end of the mean girl ish. It's not fun. Facts. Reapplying. That's right. Oh, you want to know about reapplying, Sandy? Okay, I'll answer your question. Hoping I won't have as difficult a time as nursing school as being a caregiver for years, right? I was just accepted into nursing school. Shout out to you, Smile. I start in January. Shout out to you. Reapplying for testing example. I have to do application, then what? Okay, so if you're trying to reapply to take your NCLEX, right? The first thing that you need to do is that you need to reapply at your board of nursing. And that could cost you anywhere up to $100 to $200. So for me in Texas, it's $100 per application. Remember, I took my NCLEX 4 times. So that's $400 just in applications, right? So, and then once you do that, you have to apply at the board of nursing. And then you have to apply at Pearson VUE. Now, applying at the board of nursing, they will then send your authorization. They will then send the correct paperwork to Pearson VUE. And then you have to pay for Pearson VUE. So that's $200, right? So if you think about it, that's 4 times, that's 4, 8. I'm sorry, it's 2, 4, 6, 8. That's $800 in just in Pearson VUE, right? So that's 8, 9, 10, 11, 12. That's $1,200 total that I had to pay. Okay. So once the board of nursing sends stuff to Pearson VUE would then send you your authorization to test. That is when you can schedule your exam. Can I ask, how long have you been out of nursing school? I graduated nursing school in 2018. Smile says, thank you. I'm in Florida. Okay. It should still be the same process, Sandy, for in Florida. It really should still be the same process. Do I do fingerprints in Texas? So I only had to do fingerprints initially, and that's when I went into nursing school. But when you reapply to try to take the exam, you don't need it because the Board of Nursing already has your application. They already have your initial application and your status and all that good stuff. So, woo, I think I caught up to everybody's questions. So shout out to all 38 of y'all rocking with me. I know we had a whole bunch of folks up in here, but I appreciate y'all still rocking with me. If you guys are new here, my name is Kevin. I go by the Boot Nurse. Make sure you guys check me out. Check my link tree. Check out the 7-day NCLEX course. Especially for all those people that are about to start school. If you want to get an NCLEX course for freaking $48, yo, I'm just saying. For $48 and you get it forever. Just check it out. And if you don't need it, send it to somebody else. You never know. What's up, DeWood? I know you still here. I know you left, right? Jam said, hey, enjoy your videos. Ma'am, I appreciate you for joining the videos. Here in Florida, we do every 6 months. You have to do fingerprints every 6 months? What? Is that Manning kid in Texas yet? Honestly, I haven't really been paying attention. I think he is though. I think he's I don't know if he played this past weekend. Is it Karsten said hello? What's up? Nursing student. Is it Karsten? Am I saying it right? So, damn, that's crazy, Sandy. Like that's crazy. Like I didn't know you have to take him every 6 months. Like, is it like every 6 months every time you apply for an exam? Because that's wild. Because we only had to do it once. Now, to my knowledge, that hasn't changed. But then again, I haven't had to take my NCLEX in years and plan to never ever take it again. So, but yeah, shout out to all y'all. Hey, I want to know who you are, where you're at in your nursing journey. What if you're new here? That's what I want to know, right? So I want to know who you are, where you're from, where you're at in your nursing journey. I want to know all that stuff. Are you a brand new nursing student? Are you a prereq student? Have you taken your NCLEX? Are you a first year nurse? Like what area do you work in? Like I want to know all that. We're trying to foster a good environment down here in this chat. So if you guys got any questions, hey, drop them down there. Got my co-host Miss Manasa Hari down there. A little bit about Manasa. She works on a med surg floor right now, and she actually just got her master's in nurse leadership. And like I said, she's my co-host, and she is the first person that I coached to help her pass her NCLEX. If you guys don't believe me, you guys go check my YouTube, my Instagram, the TikTok. And it's the one that says I passed my NCLEX on the 7th time. So, and me and Manasa have been cool and have been friends ever since. So shout out to Manasa for being here because I know that she worked all weekend and she's probably tired of me now. So, but shout out to everybody. Let's see. Jam says, I'm new. Mom of 2 applying for nursing school in November in Hawaii. Hey, so you live in Hawaii. All right. How's everything going over there? With Maui, everybody's safe, the family. I know it's been kind of crazy. We're outsiders looking in. So hope everything's going well over there. Karsten said, I'm a prereq nursing major. Great. Or doing great in A&P so far, 90% on my first 2 quizzes. Shout out to you. Hey, there's a lot of good YouTube videos that are out there for A&P, Karsten. Like Khan Academy is a really good one. There's a bunch of good ones out there. So definitely utilize that. Smile says, I'm new here. I graduate this fall with my ASN in science. Shout out to you. Finished all prereqs, now heading for my BSN. Okay. All right, cool. Hey, before you know it, you'll be here. Before you know it, you'll be there. Hey, I'm Ty. I'm an LPN student, almost done with med surg and mental health, trying to get through it. Hey, don't try. You got to get through it, Ty. You got to get through it. You got to put that head down and you got to push. Sandy said, I guess they want to make sure, we aren't doing anything bad, and that's Florida. Well, you got to also think about what just recently happened in Florida, especially like Florida and Georgia, and they ain't trying to get no fake nurses out here. You know what I'm saying? Shout out to all the fake nurses. I'm just playing. We don't want no fake nurses. That's probably why they're doing it. So Smile says, working in healthcare as a CNA now, start my RN program in January. Okay. Shout out to you. Hey, y'all are going to make it. Hey, speak it into existence and it shall be so. I promise you. Whatever you give the universe will give back to you. Times 10. Jam said it's going okay. Definitely trying to rebuild and recover for sure. I'm glad that's working out. I'm an LPN currently in an RN BSN program. Shout out to you. Is it Erica or Arica? I don't know which one. I really don't know which one. You gotta let me know which one. Shout out to all 44 of y'all up in here. So what are the questions y'all got? Well, it's Erica. It's like Erica. You got it. Okay, cool. Got it. I got it. Be like, Erica. I'm over here like Arica, and I'm just like, man, maybe if I had an accent, it would sound different, but I don't. So, you know what I'm saying? So, man, I got a bunch of stuff I got going on today. Like I recorded, I have two more lectures to record. One is hyper and hypomagnesemia, and the other one is oh my god, hyper and hypokalemia. Y'all already know. Talking about in regards to the fluid and electrolyte imbalances. You already know I'm all about it. All right, let's see. It says Ty, Kevin, my desk is set up and ready. That's what I'm so proud of me. Hey, you look, be proud of you. Be proud of you. Nobody will be more prouder. Nobody will be more prouder of you than you. Everyone else speaking to you and telling you how proud they are, that's a second. That is a second place thing based off of you. You need to talk about you. You see what I'm saying? It took me forever to decide that I wanted to go into nursing. LOL. I went for LPN, MA to surge tech. So you went from LPN to an MA to a surge tech? That's kind of going backwards, but I mean, maybe. I don't know. I mean, I was an LVN essentially in the Navy, you know, and then I became a surgical tech. And I've been I'm still a certified surgical tech, you know what I mean? But I haven't done anything surgical tech related since 2016. And that was right before I stopped right before I started school in 2017. So, I get it. Some people you kind of gotta go around trying to figure out where you want to go. You know what I'm saying? Kevin, it's not Ty. It's thank you. Oh, my bad. Look, his name is Ty, and he said something to me. So I replied to him, okay? Jeez Louise, my God. Real quick, after LPN, should I go for RN? Or should I go to RN for experience or straight to BSN? Finishing goal is MP. So Ty, and I'm talking to Ty now, Monica, Lord of mercy. That all just depends on you. If your end goal is MP, cool. All right, I'm tracking. I'm picking up what you're putting down, right? But if you're going to go, like if you have the funds and if you're still properly motivated to move your way through, then keep going, right? Now, when people say RN, let me go ahead and clarify for people that don't know. Your RN is your license, right? And I really don't like the fact that schools like publicize is saying RN to BSN because BSN is not a license, it's a degree, right? An RN is your license. Now, when it says RN, it's saying you get your associate's degree in nursing as a registered nurse. And then for BSN, of course, it's your bachelor's of science of nursing as a registered nurse. You take the same licensing exam. ADNs and BSNs, they take the same one. Okay. So honestly, go to where you feel it would be easier for yourself. If it was me, I would go LPN to ADN RN, do the 2 years, right? And then get your RN rather than go the BSN route. But then again, that's me. It just depends on what you want to do. Any tips for HESI test taking study? I'm in my last year of RN school. Our finals are HESI. Well, let me tell you, Kari, I hate HESI because I had to take HESI too, and it's fucking terrible. So if you're talking about like your exits, which usually for HESI, if I remember, it should be like transitions, management of care, and stuff like that. The Saunders book. Smile says she went from CNA to RN, or CNA to RN to CRNA. That's a long-term goal. That is very much a long-term goal. And I'll tell you right now that my goal for the longest time was for me to be a CRNA. Like you couldn't tell me nothing. I was going to an ICU. I was going to do my anywhere from 3 to 5 years working in an ICU. And then I was applying for CRNA school. It was happening. You wasn't telling me nothing, right? And then I started working in the ICU with my 16 years of Navy experience. And I'm just like, you know what? I don't know if this is for me anymore because I found my passion. You're welcome, Ty. But I found my passion in teaching. And I found my passion in teaching when I started working in the ICU. Because my first day of working in the ICU, I flat out said to myself, and I said it out loud, and I was just like, ooh, I don't like this. I don't like I love the knowledge. I love all of the knowledge and all the experience that I gained working in the ICU. I love it. Like nothing can compare. I promise you. But I did not like standing up for 12 hours. I don't like how like older nurses were talking to me like they lost their fucking mind. Like, I got tossed around a lot, and I mean a lot. Like, if you guys go look at why I quit the ICU videos, you will see how my experience was. It happened to me during COVID. You know what I'm saying? COVID was what it was. There was nothing that we could have gotten over with that, right? But me going into ICU really showed me where I really wanted to go, and that was back to education, back to the educational realm. But I am very grateful for the experience that I'm getting working bedside, because now it's relatable. Like, now I'm relatable to everyone that is going to nursing school, passing their NCLEX, and then doing their first year as a nurse. Now I'm relatable. You know what I'm saying? Like, imagine if you had somebody in here who was 60 years old, who had been out of bedside for 25 years trying to tell you what to do. You're going to be like, huh? Like, are you out of touch? Because most people that are that old are out of touch. You know what I mean? So I'm just saying, CRNA was my goal, but now it's not. It's education. So I'm working on getting my master's in education. I love to teach. I actually applied for an adjunct position at a school because I love to teach that much. And so, just a lot of things going on, but shout out to you, Smile, for wanting to go CRNA. I give nothing but kudos to people that want to go CRNA route. In Hawaii, they offer a program where you can go from associates to a PA. So here's my thing, is that if you want to be a PA, go be a PA. Like, do not pass go. Do not collect $200. Go straight to being a PA, right? That's a nurse anesthetist, right? Yes, Abby, that is correct. I work in a neuro ICU now, and I love it, but I'm glad you found your niche. That is my niche. Like, I love the ICU. Like, even working in the OR, even working in the PACU, like when they had patients that would come in on drips, I'm like, that's fine. They would give them to me because I had the ICU experience. Other people, they didn't. And so I was like, okay, I got it. Doing prereqs right now, and I'm terrified of nursing school. Well, hey, if you're terrified of prereqs, and if you're terrified of nursing school, if you're scared, go to church, Mary. If you're scared, go to church. So you better get unscared. COVID was bad. Abby, that's why I didn't want to be a surge tech on my feet all day, and I heard some surgeons are mean. So I'm a circulating nurse. I'm an OR nurse too, and there are a lot of surgeons that are mean. There are a lot of doctors, just period, that are mean. I'm just keeping it all the way real. They don't talk to me like that, because I had one doctor talk to me like he lost his mind, and I had one doctor, one a female and one a male, and I was just like, hey, I don't know who you're talking to, but you're not talking to me. That was to the male. And then I told the other doctor, hey, I'm not your husband and I'm not your son. I'm trying to help you. Don't talk to me like that. And then, of course, it was just like one of those like, oh, I didn't expect for a nurse to talk back to me. I'm telling you right now, if you're wrong, like if I was wrong, that's different. I would take that L and I would take it for what it is. But you ain't going to talk to me like I'm your slave. Probably not the best choice of words, but you know what I'm saying, right? You know what I'm saying? We need educators, and that's a wonderful field to go. I love teaching. Like, it's weird. I'll sit on here and I'll read. You can ask Monica. I sit here and I'll read and I'll research, and then I'll be like, hey, look at this. And she like, she calls me a nerd and all this stuff, So, do you think it's worth becoming a nurse for, aesthetics? Jade, if you want to go and work and do Botox and do fillers and lip injections, obviously, I don't got that problem. But if that's what you want to go do, and if that's your passion, go do it. Go do it. I can tell you there's a lot of nurses that I work with that they were just like, hey, I'm just here for my experience. And then 1 year and 1 day, they left to go do, aesthetic nursing. So it's there. You would be a great teacher, a great addition to any college. I appreciate that, Jim. Or school. Yes, I'm trying to do my thing. You would be great talking to kids in schools considering nursing. Yeah, but then it's like, so nursing is very up in the air. My biggest thing is I will, probably tell them too much to kind of maybe stir them away. But then again, if I stir you away from something, then it was probably never meant for you. It was probably never meant for you anyway. That's what I heard. You have to stick up for yourself. Yes, you do have to stick up for yourself. And trust me, I've walked into many of med rooms, and I've seen nurses crying. Trust me, I've seen it. I think you should do nursing education. I am going to do nursing education. I am going to do it. I'm going to do it. Like, that is where that's why when I became a nurse, and the first time I could become a preceptor, I was there for it. I was just like, how do I become a preceptor? And they were just like, oh, well, you have to be on the floor and blah, blah, blah. And I was like, all right, cool. So how long do I have to be a precept? Or how long do I have to be on the floor? And I think you had to be a nurse for like 6 months before you could precept. I've seen some people precept and it's fucking terrible. Most of my preceptors were terrible, except for like 2 of them. And I had like 9. I had 9 preceptors, y'all. 9. I know I said in my video I had 7, but I had to think about it. I thought about it. There's 2 more. I had 9. And one of them, it was Jana, it was Amanda, and another one. Like DJ Khaled, you know what I'm saying? But those 2 were awesome. They were phenomenal teachers. Phenomenal. And I wish I could have had them, but that's just not how it worked out for me. I'm always worried about being too emotionally involved in with patients. Is there a way to balance that? Jam, I'll be completely honest with you. You have to leave it at work. And then I know it's a lot harder said than done. Like there have been plenty of times where I came home and I was thinking about patients that died, or I thought about, oh my God, did I give them the potassium? Oh my God, did I stop the potassium? Oh my God, like, did I give him enough? Did I give him all that D50 because they're hypoglycemic? Like you have to leave it at work. And then here's another thing too, is just like, if it really does start to bother you, and that's anybody that's in here, if it's really starting to bother you, go talk to somebody. Like your mental health, that is number 1, period. You need to have your mental health in check. Because one of my preceptors, literally the job, she had been a nurse for 5 years. And then when COVID happened, the job just destroyed her. And she like went away for like a year. So definitely that's how you balance it out. Do you think there's a big difference between a nurse practitioner and a doctorate of nurse? Yes. So the doctorate of nursing practice is the degree, Jade. Like being a nurse practitioner is doing the act of being the actual professional. So you could have your DMP and be a nurse practitioner, if that makes sense. So a nurse practitioner can have their master's, their MSN, or they could have a DMP. So the nurse practitioner aspect is the aspect of like performing the duties of an advanced practice nurse. Okay. I've never gone to school for anything. How do you balance work or school work relationships? My husband and I barely already get time together since he works overnight. I'll be completely honest, because I had this problem a lot. Remember, I worked active duty. I was married at the time. I had a whole bunch of other stuff going on. You really, really, and I mean it, you really, really have to prioritize your time. And then when I say put yourself on a schedule, Abby, listen to me. You got to put yourself on a schedule and you have to follow it as much as possible. Nursing school is intense. It is very, very time consuming, right? Especially if you have kids. Like I'm telling you, I would go to work all day and then come home and study until 1, 2 o'clock in the morning and turn around and do it every day. You know what I'm saying? So you have to put yourself on a schedule. You have to do it and you have to follow it. And the other thing is that your husband, I'm not saying how your relationship is, but your husband has to be super supportive of that. And he has to understand it. I'm telling you, we're in September. August and September are the times where I see so many nursing students saying that my husband wants a divorce, or my boyfriend left me, or my girlfriend left me. I don't know what to do, blah, blah. You name it. I've heard it. So just saying, you want to have control over that before you get to those points. Okay. Jam said, question for the people in the chat. How many seats are available in your nursing program? Okay. Thank you. I felt that personally, been through some things, and my son's nurses were our everything. Okay. Hard time. Yep. Med-surg is crazy. I failed my NCLEX on June 8th. I take it again on September 28th. I'm a second lieutenant. Any advice? Well, second lieutenant, if you don't pass that NCLEX, you won't be a second lieutenant. And I don't mean to say it like that, but I understand you must be in you must be like in the ACT or whatever the Army's equivalent is. It the ACE, the enlisted to officer program as a nurse. So here's one thing I'll tell you, since you're going to take it again on September 28th, sir or ma'am. The one thing I'll tell you is, I will be a second lieutenant, just not as an Army nurse. A second lieutenant, not as an Army nurse. Oh, are you going into the Air Force then? It has to be the Air Force then. So here's one thing I'll tell you, soon to be lieutenant, is since you failed, get that test breakdown. As a matter of fact, hold that thought. Don't go nowhere. Hey, all right, here we go. So check this out. So everybody, if you failed, will get something like this, right? And I think they actually do it online now, but this is your test breakdown. And it's looked backwards, but it says, this is what I failed. This is my second test failure that I did. This was September 28th. Holy shit. September 28th of 2019. You hear me, LT? You hear me? You picking up what I'm putting down? What you need to do, get that test breakdown. And you need to look at the sections that you didn't do so well on, right? Below, near passing, below, blah, 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 blah. And then that is how you should create your testing plan. For me, I knew it was pharmacology. I knew it. I already knew it, right? So you need to grab that breakdown and you need to create a study plan based off of that breakdown, okay? That's what you need to do. Recreate the testing center. You're already at an advantage right now because you know what the testing center looks like. Am I right or am I wrong? Right? So recreate it. No phones, no snacks, no Cheez-Its that I didn't can eat, right? No water, no nothing, right? Put yourself on a schedule. Create a study schedule. Cancel out the noise. Cancel out all these people that don't matter. Cancel them out. Cancel them out. And then put your face to the ground and you need to push. You're at this point where you failed your exam, and I don't think I saw you in here at all, but I'm about to say something to you that I really hope that you understand, that get off the beach. You failed, but you failed and you're still on the beach. I'm going to need for you to get off that beach because you know what's going to happen to you if you don't get off the beach. You know what's going to happen to you, right? You know what's going to happen. All right, I kind of focus on that one. Hold on, let me see. No kids yet, and that's why. Okay, that's fine. I didn't have my first kid until he was born last year, so that's fine. It's okay. I feel I used to work in a burn. So my first experience ever as an ICU nurse as a nurse. Period, was in a burn ICU, and I love the experience that I got there. Is being an MP worth it? This is Sarah. Hesitant to go back to school for it. Why? I'm not an MP, so I couldn't tell you. And it all just depends on what type of MP that you want to be. There's different types of nurse practitioner. You can be a nurse practitioner for holistic medicine. You can be a nurse practitioner for doing aesthetics. You can be a nurse practitioner for acute care, psych, pediatrics. There's so many things that you could be a nurse practitioner for. I would recommend going to nurse.org and looking at at all of the certification that you can get as an MP. He's 1,000% supportive. I love that. Abby. He's been pushing me so hard to go to school for the last few years. I love that. I love that for you. I really do. Like, no cap. That's what the kids say, I think. So, sorry, I didn't mean to send that. I didn't. Okay, no worries. I will still be a second lieutenant. Just got that. Okay, cool. Thanks for adding the ma'am. It shows your character. What? Oh, I got you. I couldn't tell. I couldn't tell who it was from the, what's a PA? A PA is a physician's assistant. Oh, wow. Same day. Yeah, I know. Same day. Yes, correct. They don't let you bring water bottles into NCLEX. No, sir. You can't bring nothing but yourself. I'm surprised they let you bring your body in there and they don't let you sit outside and like you have to, astral project your body through a door. No, you cannot take a bottle of water. You cannot take snacks. You can't take a jacket. You can't wear a watch. You might as well just be going to jail. I ain't never been to jail. But I'm assuming when I watch 48 Hours in lockup and stuff like that, that's what it's like. So PAs do the same thing. What do you mean, Kenzie? Also, is the NCLEX on my laptop? It's on an actual computer. Like it's in a computer lab, like a computer lab where there's nothing but computers. All right, LT. I'm glad you picked up what I'm putting down. I explained it earlier, and some people were like, "Whoa." I'm applying for nursing school at the end of the year. If I don't get accepted, should I try again? I'm not even going to answer that question. Why? You already know the answer, so I'm not even answering you. I am definitely going to have you tutor me when it's time. Look, I'm just saying, if you want, if anybody wants one-on-one tutoring, you can go to thebootnurse.com and look at my NCLEX mentoring and coaching tab, and that'll give you everything that you need if you want it. Thank you. I will be rebranched into another MOS if I don't. I know you will. Because in the Navy, because I'm in the Navy, that's where I'm at right there. In the Navy, when you do the MECEP program, the Medical Enlisted Commissioning Program, if you fail your NCLEX 3 times, they send you back to your MOS or rates, as we call them, and you go back to being enlisted. So there's that. I understand 100% what you're talking about. Did you have experience prior? What do you mean, Kenzie? Thank you for your opinions. You're welcome. But us Hispanics have a low pass rate on the NCLEX because my college didn't prepare. Look, so I'm going to tell you something right now. LT. You can never use that as an excuse, ever. You want to know why? Because everything is your fault. What was the site you said? The site is The Boot Nurse. So look, thebootnurse.com, and you'll see it on there. LMAO, I can leave snacks and bottled water. Yep, you can leave it in your locker. No water is crazy. My organization requires acute care along with FNP. So in order for you to become a nurse practitioner, you have to have at least a year of experience. How long does it take to finish it? Finish what? So you have 5 hours to take the exam. And you can take breaks. You can take as many breaks as you want. However, your NCLEX will not stop. It is a running clock. So if you go and you take a break, that time is still going. So I'll give you an example. I had to take a break. It took this lady 5 minutes to come and get me. And then another 5 minutes to check me out. Like, you have to do a biometric scan. You have to, like, sign out. She has to physically see you. And then she's like, okay. And then you go. It took, like, before I knew it, when I came back, it was already 20 minutes. It was off of my test. Okay. So think about that. When you're preparing to take your exam, you need to create that endurance while you're sitting in front of this computer. Okay. I'm taking my esthetician test next month, and my friend told me they don't allow anything at all. Well, it depends. So as an esthetician, you can perform those acts. You can perform those acts as an esthetician. You sure can. But you got to think about, there are other levels. There are other levels. I mean, I'm not going to say like, hey, I'm going to go and be a doctor, but I'm going to go through this program to where I don't have to do anything. That don't make no sense. Think about that. Okay. Santiago. I'll try again. Always try again. Always try again. I can't grasp pharmacology. So the one thing I'll tell you about pharmacology, family name, suffixes. You weren't here when I said it earlier, but learn about where your drugs fall under. So if I start saying cardiac, I need for you to start spitting out to me, what are cardiac meds, right? You got ARBs, you got ACE inhibitors, you got ARBs, ACE inhibitors, you got beta blockers, calcium channel blockers, DIG, right? So, okay, now we're going to talk about beta blockers. All beta blockers are LOL, and all LOLs are beta blockers. Cool. Now that I know that a beta blocker is a cardiac med and a beta blocker is an LOL, now what are the signs and symptoms of that medication? What is the purpose? What does it do? Drops blood pressure, right? What else does it do? Am I thinking about orthostatic hypotension? Am I thinking about my potassium? Is it going to go up? Is it going to go down? Like, am I going to think about syncope episode? That's how your mind has to think critically. Okay. He says, true. I feel confident this second time. Most of my friends pass it on the first. Don't think about your friends. Don't think you're not taking your friend's test. You're taking your test. PA school was 24 months for me. Boards were the same as you are explaining it. Yep. Do you tutor for the T7 entrance test? Blair, I do not. I do not tutor for that. I only tutor specifically for NCLEX. You're not the first person to ask me that, but I'm thinking about doing it, but I don't want to spread myself too thin. I took mine today and I didn't pass. Stangal, you didn't pass? Tell us what's up. Tell us what's up. And you didn't pass. So what are you about to do? What are you about to do? And you've been in this chat. We've been going back and forth, right? You've been in this chat. So tell me right now what you are about to do. How long is school to become a PA? I think it's like 2 years. Does it depend on, I think it's a 2-year program. Do you feel like there's good work-life balance being a nurse? It depends. It depends on what type of nursing job that you have. A lot of people feel like they don't like working on the floor, and by the floor, I mean bedside nursing. Kenzie, you're welcome. I'm here all the time, like Monday, Wednesday, Friday. It's 5:30. Misha said I'm late. Yeah, girl, you was late because you late. We only did 20 questions today. You late, you know what I'm saying? So, a good work-life balance is, working your recommended hours. And then, when you go home, you don't do nothing nursing related. 24 to 30 months for PA programs. Yep. I do know, like my buddy, he just graduated PA school at the beginning of August, and his was a 2-year program. It took him a long time to get into that program too. He went to Duke. So, that's after you get your bachelor's. Yeah, because PA is a master's degree program. If I remember right, and correct me if I'm wrong, Kenzie, but, you have to have, it's just like going into med school. You have to have your science classes, but you can have any degree, to get into PA school. Yep. Yep. And, I know LT, that second lieutenant, I don't know if he's still in here, but, they may not have prepared you. They may not have prepared you for you to take your NCLEX. And that's how I felt, right? And just like everything else, they're going to tell you, hey, how are you going to figure it out, right? Like, what type of learner are you? Like, think about the things that you didn't do. I'm debating now if I should do PA in dermatology or MP aesthetics. Well, only you can make that decision. Both seem like really good directions to go. You can be a nurse practitioner, a dermatology nurse practitioner as well. You can do that. I'm telling you, if y'all haven't gone to nurse.org and look at their certifications that you can get as an advanced practice nurse or as an MP, there's a lot. There's so many. I'm like, whoa, there's a lot of them on there. As a matter of fact, I'm going to find them and we're going to sit here and we're going to talk about them since everybody wants to know that. Let's find out right now. Shout out to all 32 of y'all that are in here that are listening to me run my mouth. My name is Kevin. I go by the Boot Nurse on all social media platforms. I want to know who you are, where you're from, where you're at in your nursing journey. We're in here talking about nursing, NCLEX, like are you a prereq student? All that good stuff. If you're a new student and you just started school and you're looking to get a jump on your NCLEX, which is the licensing exam, check out the 7-day NCLEX course for $48, 80% off. Once you get it forever. It's in its pre-launch phase right now, which means we are building this Spirit and Frontier airline to become Air Emirates. Just not no Air Emirates price at $10,000 in first class. However, them first class TikToks be looking nice as fuck, but I'm just letting y'all know. Make sure y'all go check that out. Link is in my bio. That link tree will take you directly there. All right. So let's see. Here we go. It says, if you go to nurse.org and if you go to where it says resources and then go under resources, it'll take you to the tab. It'll right there in the middle. It'll say, complete list of common nursing certifications. Click on that, and then that'll give you this massive list. It'll give you this massive list of all the credentials and certifications that you could get as a nurse and as an advanced practice nurse, aka a nurse practitioner. So let me see what's going on. I want to have my own business, and I actually have an associate's degree in business. I'm thinking maybe PA. So, hey, I just want to let you know is that you don't have to have any of that to start your own business. But I understand what you're saying, because you can have any degree, right? Yeah, you can have any degree. If I'm right, you can have any degree as long as you've met the prerequisite requirement classes. But when you apply for a PA program. I was fortunate because I was a paramedic for 10 years prior to going to school. Okay. My buddy, he was a surge tech before he went to PA school. After getting my RN, are there a lot of options for specialties? Girl, yeah. What do you talk? Abby, come on, girl. Come on. The experience was worth it or worth everything. Shout out to you. Okay, cool. Thank you. Correct. Okay. Got it. All right. So like right here, like, if you wanted to be, they have like, let's see, they have, the adult gero primary care nurse practitioner. You could be, what is this? An advanced HIV and AIDS certified nurse practitioner. Like what else they got here? Acute care nurse practitioner, adult health clinical nurse specialist. That's a master's degree. Advanced. Oh no, that one's different. Advanced diabetes management. You could do forensics as a nurse. What else? Genetics, holistic medicine. I think I just talked about that earlier. You can do oncology, wound care, diabetes, blood and marrow transplant certified nurse. You can be a certified aesthetic nurse specialist. Literally, that's what it says right there. Literally, right? So you could be a certified addiction nurse. So if you wanted to work in what is it? If you wanted to work like in a rehab facility or anything like that. All right. Sorry. Just always question everything. No, that's fine. If you don't ask questions, you'll never get the answer. I love this. You're so knowledgeable. Look, oops, Allie, oops. This is what I'm about. You're very knowledgeable. You've answered so many questions I've been having. I'm glad that I could answer the questions for you. Forensics. Oh man, that is my dream. I didn't know that was an option. That's what I'm trying to tell y'all. So let's see. You can do, what is it? You could be a breastfeeding counselor, a certified breast care nurse, a certified burn registered nurse, a certified consonants nurse, childbirth educator, corrections. What else? Hemodialysis, acute care, research, clinical research. You can do tele-ICU. You could do coordination and transition management, dialysis, diabetes, emergency room. Hell, they have one right here called care of the extremely low birth weight neonates. Huh? Didn't even know that was a thing. Certified foot care nurse. So all those that got, foot fetishes, you can go be a foot nurse. I'm just saying. Perioperative nurse, flight, gastroenterology, heart, non-clinical heart failure. You could do hospice and palliative care. A certified lactation counselor. You could be certified in infection control. You can do cardiac medicine. There's some other you can do. Be a nurse educator, nurse leader. That's what Manasa is a clinical nurse leader. You can be a nurse midwife. What else? Nurse manager and leader, certified corrections, nephrology, neonatal neuro intensive care, nephrology, corrections, like wound care for ostomies, occupational. You can do ortho-rhino-laryngeal. You could be a ENT nurse. You see what I'm saying? You can do all of that. It says, they said I'm a nurse leader. I didn't even know what that means. So clinical nurse leader is exactly what it says. Let them know. Let Mana say exactly that, and she'll tell you. That's what she got her degree in. Post anesthesia, so you can get a certification as a PACU nurse. Pediatric hematology oncology, healthcare quality, health risk management, principal. What else? Plastic surgery, right here. Certified radiological nurse. I have so many of y'all that came into my chat on Monday that was just like, I want to go work an x-ray. I was like, there's literally our website. You get a CRN, right? And it's I don't know what the website is right here. It's a lot, but you could be a radiology nurse and work in radiology, right? Helping shooting x-rays and all that jazz. What else they got on here? A nurse anesthetist, research. You can be an infusion nurse, cardiac nurse, urology, vascular, wound care, ostomy, dermatology, right here. A dermatology certified nurse practitioner, right? I don't know exactly what they do. Like right off the top of my head. That's why I said go to nurse.org and then go down to where it says freaking resources. And in resources, you'll see all that stuff down there in the middle. Go check it out. What else? You could be a faith community nurse. Don't ask me what that is. I have no idea. Psych, public health, pediatrics, community, informatics, school nursing, sexual assault nurse examiner, a stroke certified nurse, trauma, wound care. There's so many. Like, I don't even know how many this is. I skipped over so many of them, right? I guess we just have to pass that in class and we can be anything. Look, I'm telling you, all you need to do, get through nursing school, find your passion that you want to do, and then once you become a nurse, and then go. And let me tell you something, there's nothing wrong if you go to one area of nursing and you don't like it. You can always switch and go to something else. I literally have gone to 3 different spots: ICU, PACU, and then OR. And I have no shame in telling nobody that I did that. Other people look at you and be like, I'll be like, yo, you don't know my life, so get out of here. You know what I'm saying? Biggest thing, people, is to tell me to focus on one thing at a time. That's it. One thing at a time. So wherever you are currently, you need to focus on that task that's right in front of you. Okay? As well as, there's nothing wrong with having, a goal set out for the future. But you ain't getting to that goal unless you get done what is in front of you. That's right. Facts. So shout out to all 16 of y'all that are in here rocking with me. I know I'm sitting here running my mouth and I'm pretty sure people are just bored of it now. But hey, we did a lot of knowledge today. But your boy's about to check off so we can go eat and, go play with my family for like 20 minutes and then go do whatever I need to do. But this is my last little plug for myself. Once again, shout out to all y'all that are out here hanging out. My name is Kevin. I go by the Boot Nurse. Make sure you guys check out my link in my bio. That takes you to my link tree. Make sure you guys go check that out. Remember, get off the beach. Wherever you are in life, get off the beach. Make sure you get off the beach. Make sure you guys follow me. I need as many followers as I can. I need 10,000 followers. So that way I can stream from the computer. I got a nice camera over here, and I would rather have the camera pointed at me this way than, this way. So, last little plug for myself. If you are a nurse, a nursing student, or even a prereq student, and you're looking to get a jump on your NCLEX right now, it is before you even do anything. Check out the 7-day NCLEX course. That link is in my bio. It is the first one on my link tree. Check it out. It's going for $48. Once you have it forever. So if you're an LPN and you want to go to, if you're an LPN and then eventually you want to go RN, you can use the same NCLEX review. You see what I'm saying? And it's for $48. It's a one-time payment. And you guys are actually helping me build the plane as we are falling from, I don't know, space. I'm just saying, we got a lot of content coming. Monis is right. We got a lot of content coming. Like I said, I just got finished recording 2 videos, and I got a whole bunch of pharmacology videos to record and a whole bunch to put out there. So within the next couple of weeks, whoever has it, you guys are going to see them there. The new generation NCLEX stuff is also coming. That is in the works. Trust me. I hear and see everything that people tell me. I listen to the feedback, and I'm giving you guys what you want. Just got to take some time. So like I said, if you are a new nursing student or even a prerequisite student and you're looking to get a jump on your license right now, even though you're not going to be taking that exam for another year, 6 months, even if you're in school, or 2 years before you graduate, check it out. I don't know anyone anywhere that wouldn't be like, yo, I got it for $48. And then when the price goes up, people are just like, man, I had to pay this. And you're like, should have been an early adopter. See what I'm saying? So that's my last plug. Check out the 7-day NCLEX course. Be a part of the movement. All right. And lastly, like I said, get off the beach wherever you are in your life. Karen, you're welcome. You're very welcome. Get off the beach wherever you are. If you stay on the beach, you'll never progress. So you need to go forward. Alley oops. Thank you for the roses. I appreciate you. I appreciate all the love and support that everybody gives me. We'll be back on Friday, 17:30, maybe a little bit later because we have some appointments. But 17:30, and we'll do another batch of questions per somebody's recommendation or ask. We will probably do fundamental questions. Why not? Why not? So good night, Kevin. Thanks for studying. You're welcome. You are welcome, sir. So until then, hope everybody has a good rest of their day or rest of their evening, has a good day tomorrow, and I will see everyone on Friday. So bye.